Okay. Welcome, everybody. We're delighted that all of you were able to join us today for this first of its kind um, convening that we're having today. Center for Student Success is pleased to be partnering with the Mental Health Association in New Jersey to have this launching event addressing the mental health of community college students. I want to run through the agenda just right quickly to give you a flavor of what's going to be going on today. Then I'm going to turn it over to Council President Aaron Fichtner for some opening remarks, and we'll hear from other folks kicking off from there. So we'll do a brief welcome. Welcome, everybody. As I mentioned, we're pleased that Stephanie Verdugo Hernandez from Rowan College at Burlington County is joining us to set the table for us today. We're going to hear from Mary Jean Watson about the overview of New Jersey's mental health system. Betty Jean, the Director of Call Center Services from NJ Mental Health Cares, will join us to talk about assessing community and private mental health services. We're going to take a little brief 15-minute break. Then when we reconvene, we'll hear from our friends at the Mental Health Association, Jamie Angelini and Ruth Kaluski, about evidence-based mental health awareness training programs. Then we're going to have a panel discussion. We're going to hear from our friends at Hudson and Passaic County Community Colleges and our friends at the JED Foundation about an innovative new program that they're undertaking in New Jersey called the JED Campus. We're going to hear from Christopher June at Brookdale Community College about some technological ideas that they have in play to help assist with their mental health needs of students. Finally, we're going to hear from the team at Bergen Community College to talk a little bit about innovative campus practices taking place currently. And then we're going to do our wrap up and next steps at the end. So with all that, let me stop share so we can see you. So just a couple housekeeping things on the front end. For all of you who've done Zoom, you probably know all of this. One, if you're not speaking at the time, please mute yourself since we're recording. And we want to make sure we get a clean recording for all of you and for those who'll be able to join us in the future. And secondly, if you're able to, be on camera. We'd love to see you if your bandwidth permits. That would be great. So with all of that said and done, it's an honor and privilege to introduce the president of the Council of County Colleges, Aaron Fichtner. Aaron.
Jake, thank you for the nice introduction. And it's so good to see so many people from all over the state who are committed throughout the sector of community colleges to the mental health needs of our students. This is a really important conversation, and we're really very happy to be partnering with the Mental Health Association. And so I want to thank them, Bob and his colleagues, Ruth and others, for really jumping in with us on this important issue. I think that the pandemic and the challenges posed by that pandemic have really underscored to many of us across community colleges how important mental health is for our students and our communities. And it is good to be at a point where we can recognize that the mental health challenges of our students need to be addressed, that we need to be aware of them, and that we need to be here to help people in mental health issues as we would be in physical health issues. So this is a really important moment, a really important conversation. I want to recognize our chairman, Dr. Phil Infante. Phil, if you want to say some words, but Phil has devoted his entire career to these issues as a psychology professor at Essex County College, as well as a counselor. And I want to thank Phil for your passion to this issue and encouraging us at the council to take this on. I want to thank our student and alumni committee for raising this issue to us about how important it is. And so with that, I'd just introduce our chairman for a quick hello and any opening remarks, Chairman Linfante.
Thank you, Aaron. Thank you, Jake, and thank you for everyone for being a part of this morning. We all know, I'm a community college lifer, and we all know that sometimes it has nothing to do with their ability or academics that prevents a student from succeeding. And a lot of times it's those outside influences, their home life, and especially mental health services. We know that during the pandemic, students were faced with a lot of tough and struggled, what better way than to bring everybody together to determine how do we work on the mental health issues that our students are going to face either over the last year or coming back to school. I think it's so important for us to get together. I mean, we're not really lined up or equipped to deal with the extent that this is going to be. So we need partners. And I want to thank the Mental Health Association of New Jersey for being a partner. And this really all came about, as Aaron mentioned, we have forums with the students and the alumni. And one of the things that was loud and clear is they were so concerned about the mental health of the students and how was that going to be handled coming back. So I thank all of you for being a part of this major discussion. I thank Jake and Aaron for putting this all together. And I look forward to what's going to happen over the next couple hours. Thank you.
Great. Thanks, Phil. Thanks, Chairman. Again, this is the beginning of what we hope will be a number of collective efforts to work together to make sure that all community college students have the mental health supports either on our college campuses or with partners. And so I just want to thank everybody for being with us today to start this important journey of how we work together to address these important issues. So thank you all. Thanks to all of our partners, and back to you, Jake.
Aaron, thank you. Chairman Infante, thank you. I echo our thanks to our friends and partners at the Mental Health Association in New Jersey. We would not be here today if it were not for them helping us on this. And I'd like to introduce Vice President and Chief Operating Officer of Mental Health Association in New Jersey, Robert Clay. Bob. You're muted.
Okay, I can, and take two. Thank you very much, Aaron and Jake, for this opportunity. The Mental Health Association is very excited to be part of this partnership. We know the impact of COVID has been just bringing to the forefront some of the issues that we've known that have been out there, and gives us an opportunity to work together on them. Let me just give you a little brief history of the Mental Health Association. We've really been around for 75 years. As kind of the leading advocacy organization for mental health in our state. You know, we began as an advocacy organization working to kind of close state psychiatric hospitals back in the 40s when there were thousands and thousands of people living in hospitals. And then we began our advocacy to move towards the creation and the groundwork for community mental health centers and centers for kids. And then it's really starting to address the needs of the stigma of mental illness and substance disorders, and really battling the rise of suicide and the impact of mental illness on our families and our communities. We've always been a changing, evolving organization, and we've built our work on developing collaborations and partnerships in the community. That's the strength. We're just one organization, and we can only do a little bit, but together it's amazing what a community can do. Today, our focus is really on prevention, the access to care and treatment for children and adults. Peer support is a very critical element of the work that we've been dealing with moving forward. Creating communities of recovery in the community that people of all races, creeds, colors, the community can really participate in. And as the issues over the past year, social justice has become interwoven with everything that we do. You know, COVID-19 allowed us to really focus on the emotional impact of the pandemic on youth, persons of color, and the need for greater community outreach to underserved communities and populations. So that's what we're really excited about, this opportunity. Creating collaborations has always been our strategy, and today's meeting is a great first step to creating such a partnership and building on the strength that you've all done in each of your colleges. Everybody brings strength to the community, and partnering with other organizations on the state, county, federal level, private and partners. That's what's going to make this a successful effort. So we're excited to get us started, and I think this is going to be a great day. So thank you for the privilege of being here today and being part of this great work we're going to be doing with Jake, Aaron, the council, and the Student Center. Thank you.
Bob, thank you. Thank you for the kind words and the overview. We very much appreciate you and your team being with us. Without further ado, I'd like to introduce Stephanie Verduga Hernandez. We're pleased that one of our student leaders from Rowan College of Burlington County was able to join us this morning. Stephanie, I'll turn it over to you.
Hi, my name is Stephanie Verduga Hernandez. I'm in the 3+1 biology program at Rowan College at Burlington County. I'm going to be a senior at Rowan University this upcoming fall to graduate with my bachelor's in biology to attend medical school. I am aspiring to become an orthopedic surgeon. I want to thank you all and the organizers of this event for having such a wonderful forum where we can discuss the importance of mental health. Mental health is a topic that I am very passionate about because it has affected me personally. Since I was little, I have enjoyed helping others and giving back to my community. There have been many life-changing lessons that I have learned from that has made me stronger and the person that I am today. One of those lessons was to be resilient and to stop at nothing to achieve my goals. Since I can remember from an early age, I was bullied in school. All throughout elementary school up until high school, I was picked on. There were times where I did not understand the reason why other students would pick on me. The happiest times were when the school year ended because I knew it was not going to be picked on anymore. My high school senior year was the worst for me. I went from being happy because I was finishing my last year at school to laying on a hospital bed with a head concussion and not only being bullied physically at school, but also online. I was very shy and never really stood up for myself. During this awful time, I suffered with anxiety and depression. There were days where I simply did not want to wake up. I wanted to just sleep in my bed all day and at times would cry for hours. It was very hard for me to ask for help because I felt shameful and afraid that the bullies would retaliate and hurt me at school. Not only did it affect me, it also affected my family. It was the worst time of my life, but like they say, happiness and strength can be found even in the darkest moments. In my turmoil, I found the strength to seek help and report my bullies and face them. In my case, I found my school assistant principal to help me by listening to me and gave me a safe place to go for when I felt anxious during the school day. I would go and speak to her and let my frustration out and find ways to cope with what was going on with me. Not only would I sit with her during her lunchtime, but also with my guidance counselor, and they would teach me to find different strategies that help me with my mental health. Without help, I honestly do not think that I would be here today, happy and with my mental health back in a good place. I'm very grateful that there is support for students at schools. The omnipresence of mental health is increasing in our time. Our society's mental health stigma is the basis for why countless of people do not receive the help they need, even as their lives begin to crumble due to the prejudgment that exists. The prejudged faults placed to those suffering from a mental health disease holds back the efforts to progress with treatments and move in a positive direction towards good mental health. We need to normalize the conversation about mental health. Having counselors available at community colleges is a great deal of importance because it offers help for issues related to mental health. It offers an outlet to find solutions to their mental illnesses. We cannot judge anyone unless we walk in their shoes. In my run through life, I have mentored students that have been bullied and people who have anxiety and depression. I have been the person who listens to them and have shared the techniques that have helped me. Being a former high school class president, I unfortunately had to make class monetary donations to families of former students who had committed suicide in college. That is why I'm here today in front of all of you, because I feel we need to provide our college students with all the resources necessary, especially in these times, so that they feel we care, so that they feel that they are not alone and they too can get help just like me and overcome the fear, anxiety, shamefulness, and depression that mental health can bring. Everyone can benefit from being heard. Do not be afraid to speak up and ask for help. Everyone can benefit from knowing that there is a safe place in their campus that is willing to hear their cries and find solutions to cope with their mental health problems, to give advice to where they should go to find the professional help they may need, to at least be of guidance to those seeking help. We are a community, a family at our colleges, and we need to make sure that we can be there for those who need the help and support to better themselves and continue to achieve their dreams and life. At the same time, make the foundation of our colleges stronger and show students that they too matter. Thank you.
Wow. Stephanie, thank you. Thank you for being with us today. Thank you for your leadership. Thank you for your courage to share your story and your thoughts with us today. We very much appreciate it. And we certainly commit to you as being part of that student advisory group that today is that first step, that we make sure that students get the supports that they need. And we are so grateful to you and your fellow students to voicing this issue and bringing it to the level of importance that it needs to be so that we could be here today to get started on all of this. So thank you once again for joining us. So folks, before we dive into our presentations, just another piece of housekeeping. What we'll do is we'll ask that as you have questions along the way, please put them into the chat. And then after our presenters give their presentations, we'll address the questions as they conclude their remarks. That way we'll be able to get to everything as we're moving along. So at this point, I'd like to introduce Mary Jean Watson, the Central Regional Coordinator for the Division of Mental Health and Addiction Services. Mary Jean, thank you so much for being with us today. We very much appreciate you joining us in this effort.
Thank you so much, Jake. And I appreciate being here and being invited, but I want to start by thanking Stephanie as well. You spoke beautifully and courageously. And what I know is that when that's in your heart and on your mind, in your soul, it's an easy message to give because it's so important to you personally and to anyone else you can touch. I think you raise a really important point about how mental health is so current in our conversation. For those of you watching the Olympics, I'm sure that Simone Biles and Naomi Osaka are names that are familiar to you. I consider them champions for mental health. I've put on Facebook that I think they should get gold medals for wisdom and courage. This is a tough time. That would certainly be a tough situation. And mental health is critical to all that we do, to physical health and just being who we are. So thanks to Stephanie and to others who lead us in that information. As Jake said, I am a regional coordinator for the New Jersey Division of Mental Health and Addiction Services. It's known as DMHAS, DMHAS, DMHAS for short. I'm going to be looking aside just a little bit because I do have a few things on my other computer to share with you, and I want to be sure that I get them right and in order. Our division, or DMHAS, is part of the Department of Human Services, which, as you may know, provides services to a wide range of people, including those dealing with developmental disabilities, visual or hearing impairment, physical disability, aging issues, and in our division, mental health, mental illness, and substance use disorder. So we cover a wide range of things, and the services that I'm going to describe in my PowerPoint cover a lot of bases. We have contracts, our division has contracts with many organizations that are designed especially to serve those with serious mental illness or substance abuse disorder. However, some of the programs, which I'll highlight here in the PowerPoint, will be of interest to many of your students and perhaps your faculty and staff as well. So the PowerPoint will be distributed after today's event. Of course, you're welcome to take notes, but don't drive yourself crazy trying to write everything down because you're going to have what's on the screen available to you. I like to use this PowerPoint though, because I think it gives an overview of the breadth and depth of services available in New Jersey to those who are dealing with mental health and substance use issues. There's a lot here. Most people don't know all that's available, and we like to be sure that they do. We should have a few minutes at the end of my presentation for questions. Certainly put your questions in the chat if you want, and we'll try to attend to those once we finish with the overview. So I did send this PowerPoint along, and I appreciate your putting it up and helping me make sure that it goes smoothly. If you want to move to the next slide, please. Our mission statement is pretty comprehensive. essentially what it says is that we work with individuals, the consumers of services, as well as all others in the state to provide and promote wellness and recovery for individuals managing or dealing with mental illness, substance use disorder, or both. That's what the co-occurring disorder means. We start with prevention and offer services through a range of programs all the way up to and including hospitalization. Next slide, please. I use this multiple Venn diagram to show all of the different kinds of components that people deal with. And as you can see, all of them overlap with persons with mental illness. So we look at the whole person, try to understand what their needs are in the moment, and remember that they may be dealing with a variety of issues, not just mental illness or substance use. Next slide, please. The continuum of mental health services in New Jersey, as I mentioned, is pretty broad and pretty deep. I'm not going to review these in specific detail, but I do want to say that I will highlight a few of these later on, particularly those that might be useful to your students, faculty, and staff. But the main thing to understand is this first sentence in the bar on the left. Our goal is to provide the appropriate level of care in the least restrictive environment necessary to meet the individual's needs. That is the mindset that we start with in everything we do at DMAS, and you'll see that as we go through the PowerPoint. Next slide, please. So we have a number of services for those who are in immediate and serious crisis, including suicidal crisis. This designated screening service is essentially the evaluative system that considers whether a person needs to be hospitalized or not. We have other programs that are a bit less intensive or help people get services without going to the hospital, the crisis diversion and respites. But I want to draw your attention specifically to the last two on this slide. Early Intervention and Support Services, EISS. This is a program that I'm actually reading because I want to get this right. This is a service that could be very useful to your schools and, again, students, faculty, and staff. Early Intervention Support Services is a short-term mental health service for adults who are experiencing significant emotional or psychiatric distress and are in need of immediate intervention. So this is not the emergency room, but mental health focused urgent care. EISS offers crisis intervention and crisis stabilization services in a setting that is alternative to hospital-based ERs, and outreach to non-office-based services are available. They can make arrangements to do mobile or on-site screening. I'll get you information about how to find EISS in your county. And the good news is that although this slide says it's available in 11 counties, the current budget, the new budget that was signed last month, does fund EISS services in the other 10 counties so that we will have this program available statewide in the coming months. I'm very excited about that. I also want to draw your attention to the Suicide Prevention Hope Line, which is a New Jersey-based call center available to help people who are in serious mental health and emotional crisis. This number is one that you should probably have available in all of your centers and around campus. The Suicide Prevention Hope Line is provided by Rutgers University, and they handle approximately 50,000 calls a year. So it is active and available for all. Next slide, please. One of the most important services that we contract for is outpatient services. There are many outpatient programs, as you probably know, some of them contracted with the state, many are not. Obviously, listing of those to be available for your students, faculty, and staff would be very important. And we can talk about how to find those as well. Next slide, please. The state funds a number of rehabilitative services that may or may not be relevant to the students in your schools. Partial care is usually a step-down program or possibly a diversion program from a hospital setting. It offers intensive outpatient care up to 5 days a week. It is group-based. The one thing I will share with you is during the pandemic, partial care programs were closed for in-person programming. All of them worked through virtual support, and they're all trying to get back to in-person. Some are able to do that in small group programming for a few days a week per individual so that they can handle the space guidelines, the social distancing guidelines required now. There are also programs for supported employment and supported education for those with serious mental illness. And should you need that information, I'll be letting you know how to get more details about that. Next slide, please. There are also programs, residential services programs for people with serious mental illness. This is probably not most of your students, so I'm not going to go into detail. But again, the breadth and depth of services is pretty impressive. Next slide, please. Another program we have is known as PACT, Programs for Assertive Community Treatment. This is essentially a program that we talk about as a hospital without walls. This is a program where people can be visited up to every day. And again, is often a step-down program from hospitalization. Next slide, please. Now I'd like to talk about things that are more in the community and the kinds of services that perhaps more of your students would need or be interested in. I want to focus primarily on the top right-hand section of this slide. I want to mention New Jersey Mental Health Cares, which is a call center program that is offered by MHA&J, Mental Health Association in New Jersey. You heard from Bob Clay, who is the CEO of this program, of the agency. Bob and I work very closely together. The Mental Health Association in New Jersey is an agency whose contract I monitor. So Bob and I talk about once a week or more. And I'm very, very honored to be here as part of this program at Bob's invitation. So I want to really highlight Mental Health Cares. It is a call center that's available to offer programming, to offer information and support about mental health issues across the spectrum. It is a program that predates the COVID crisis, although during COVID, MH Cares has been handling all of the COVID-related calls that have come in to the state, and we thank them for that. This is a number that should be, again, available not only in your counseling offices, but throughout campus, 1-866-202-HELP, or for those of us who need numbers, 202-4357. Next slide, please. There also are a number of self-help services available. The wellness centers have also been closed during COVID to protect our consumers. They are trying to figure out how to get open and be available on site. But this is a very important set of programs to consider because these are the peer-supported systems. It is often very helpful to be speaking with someone who has lived experience with mental health issues. And all of these programs are providing peer support and consultation. The MHANJ has a peer warm line. That number is listed here as well, 877-292-5588, and is a great resource for people who are struggling with mental health challenges, because they're going to be talking to people who have been there, not only experienced these issues, but are managing and coping successfully. Next slide, please. That's mental health in New Jersey. I want to also mention substance use disorder services, because as we know, substance use is on the rise. Certainly during COVID, it's been a terrible challenge. And many people who have been afflicted with this experience have struggled. We know there have been a number of substance use and opioid deaths during the pandemic. And so we want to be sure that people are aware of all of the services that we offer here in New Jersey. On the next slide, you'll see a list of areas that we address, all the way from prevention to recovery, with a number of specialized services. There is a number that I'll give you in a minute for, which is a call line for substance use issues and crisis, that will also be one you should have posted in the same places as the Hope Line for suicide prevention and mental health cares. I want to highlight a few things here, though. Prevention is critical, and anything that we can do or we can help you do to provide prevention information and education, that would be very important. In terms of early intervention, the screening, brief intervention, and referral to treatment, known as SBIRT, strange name, but there you have it, is something that we are participating in and has been very helpful. Obviously, outpatient treatment, as well as medication-assisted treatment, are available through agencies with which we contract. And I also want to mention the naloxone training and distribution. Naloxone, which you may know as Narcan, is the medication that's now available to stop and treat, essentially, opioid overdose. It has saved many lives, and the state has been dedicated to getting naloxone distributed as far and wide as we can. So for the second year this year, in 2020, and I'm sure we'll do it again this year, we actually distributed naloxone statewide to pharmacies, which were giving it out at no charge to anyone who came in and asked for it. We also offer training for this use so that essentially anyone can help someone who is in a crisis due to opioid overdose. You should also be aware that there are other programs that a lot of people aren't aware of. Intoxicated driving program is one that can be extremely helpful for people who may not have a serious problem, but could, or perhaps are well on their way to crisis there. We work in gambling issues, and we also have programming to serve the deaf and hard of hearing community, as well as the disabled community, for issues related to substance use. Next slide, please. We know that families are critical to helping people dealing with these issues, and so we do fund many programs that offer family support, and we can share with you more information about that. MHANJ actually has one of those programs, and New Jersey Connect for Recovery. This has been a really important service for families helping their loved ones to deal with substance use disorder. Next slide, please. So these are the other back one. So sorry, right. These are the numbers that I want to draw your attention to. The New Jersey Addiction Services Hotline, 844-276-2777. This is a line that is available to help direct people to whatever services they need in addiction related programming, much as mental health cares is available for mental health situations. I also want to draw your attention specifically to the DMAS helpline. This 1-800 number is the main number into our offices at DMAS. And when you have a question, which I know you will, this is the quickest way to get an answer, is to call the 800 number, 800-382-6717. That call is then sent to the program analyst or regional coordinator that handles the county from which you're calling. New Jersey, as you know, maybe from New Jersey history, we have 21 counties, and that's the way the state manages all of these services, is county by county. And each county has staff from our division that works directly with the agencies that are contracted there. Next slide, please. Our particular programs, the community services unit is divided into 3 regional offices. Again, it's a county-based system. The northern region has several counties. The southern region has several counties. And my region has Middlesex and Monmouth. I have colleagues in each of the other regional offices, John Verney in the north, Dave Helfand in the south. And certainly you're welcome to call any of us if you have specific questions about services in your area. I'm going to stop there. When you get the PowerPoint, there are a few other slides that have to do with services that are specific to the COVID pandemic period, as well as phone numbers available there. But I think we've covered a lot, and I want to stop and see if I can answer some questions. Whew. All right. Okay, question. Do we have posters or signs we could use on campus? I don't believe that we have actual posters for, I take it back. We do have some. I need to find out what's available at the moment because I know we were updating some things. The ones that are for substance use are separate from the mental health ones, which I think is great. So I would need to check, but I will do that and get back to whoever would have the most information. Okay. Are there other questions, either in the chat or if you want to unmute and ask, that's fine with me.
Good morning, Doreen here from Hudson
Doreen.
County Community College.
Hi.
The helpline that you mentioned prior, the 800 number, do we no longer have 201-262 help? Is that a separate line or is that the same as the one you talked about before? The helpline. I just remember it being 201-262 help. Is that a different crisis line than I'm thinking about?
I think 262 help is not, that's a great question.
If I could add, if I could jump in, please, Mary Jane. Hi, everybody. I'm Eileen Purcell from Bergen Community College.
Hi, Eileen.
201, hi, Doreen. 201-262-4357 or help are the 24-hour psychiatric screeners that happen to be based at Bergen, used to be Bergen Regional Medical Center, now it's Newbridge. And they do psychiatric screening 24/7. They are not affiliated with the hospital, but that's who we call when we have a severe emergency on our campus.
Thank you, Eileen. Let me talk a minute about screening centers because there is one in every county, and I will share with you how to get information on that. You should know the screening center number in your own county for emergencies. I don't remember all their numbers, so that's why I wasn't familiar with the number you mentioned. But there is actually a directory of all DMOS services online. And along with this PowerPoint, I'm going to be sending you that link so that you can see the table of contents is great. It's linked. So you can click in the table of contents and find information on any of these programs. They are listed county by county within the program itself. And the screening centers would be obviously one system to have. Most often, individuals don't know to call the screening center, so that would frequently be the role that you would play if there was a crisis, a serious crisis, particularly that needed mobile response, because screening centers at this point are handling our mobile response system.
Thank you.
Okay, a question about 988. Let me just check one thing. Donna, tell me what link. Oh, is this the directory? Yeah. All right, I'm going to click on it. I'm going to disappear for a minute. Well, I'm not going to disappear from you, but I'm not going to see you. Yes, this is the one. Let me just see if this is the most updated. But the link that's in the chat is the link to our remarkably long and complicated document. I just want to be sure it was just revised. And I just want to be sure you have the most recent one if it says. I'm going to say that I'm not 100% sure if this is the latest version. So what I will do is I will send that link so that you can have it. I'm pretty sure that's right, but it doesn't have a date on it. So since it was just updated, we might as well get you the current one. Okay. But I will say this, if you click on it now just to look, go to the table of contents, you'll see the programs that I've just outlined in the PowerPoint, and you'll see that those are clickable. And that's a really easy way to find a lot of information. How 988 will launch and affect any of the current hotlines and when 988 number will be launched. Okay, so for those of you who are not familiar with 988, the Federal Communications Commission, which is the arm of the federal government that makes decisions about this, decided last year that the 3-digit code 988 will soon be established as the phone number to call for mental health crisis. Much as 911 is the number to call for fire or police emergencies, and currently for mental health emergencies as well, 988 will be set up to serve for mental health crisis specifically. As it happens, I'm the staff member from DMOS who is managing the 988 planning. So you've asked the right person. 988 will officially launch next July. What I will tell you is that 988 is the next version of what is currently known as the National Suicide Prevention Lifeline. And you probably all have the information on how to reach the Lifeline. Lifeline is the national system parallel to Hopeline here in New Jersey. If you call either, you will get help with a suicidal crisis. So when 988 launches, the current 800 number for the National Suicide Prevention Lifeline will essentially just slide into 988. I'm not 100% sure what's going to happen to the Hopeline number at this point, but it is so well known here in New Jersey. I don't know that we will discontinue it. I just don't have the information on that yet. The one thing I am asked to mention is that 988 is not set up yet. So as easy as it is and as helpful as it will be, please continue to use the 800 number. Okay. All right, other questions? Okay. Well, I think I've taken up my allotted 30 minutes, so I don't want to step on Betty's time. But obviously, you will have access to ways to reach me and the rest of our division, and I hope you will feel free to be in touch with us. I'll be sure that you get the PowerPoint and the most current information on the directory. So thank you very much.
Mary Jean, thank you. Thank you for joining us today. Thank you for this wealth of information. I'm sure I know it will be very incredibly helpful to all of our community colleges going forward and helping us to strengthen the services we're able to provide and get students to who are in need. So thank you so much for being with us. We look forward to working with you going forward as well. Thank you once
Absolutely,
again.
my pleasure.
Okay, so at this time, I'd like to turn it over to Betty Jean, the Director of Call Center Services for New Jersey Mental Health Cares. Betty Jean, welcome. Thank you so much for being with us today, and we look forward to working with you going forward as well in this important endeavor.
Good morning. Thank you for having me. Thank you for having us, MHNJ. This is certainly a great platform. It's a great community, this students and community colleges. I think it's a privilege for us to be able to offer some of our services to you. So this morning, I'll be sharing with you a little bit about much of what Mary Jean shared this morning. Mary Jean covered much about our particular services, which is the New Jersey Mental Health Cares Helpline. And so I'll provide you some additional information concerning that line. But Mary Jean has done a wonderful job of just laying out the mental health terrain, so to speak. I think it's very important to understand the terrain, especially when you're working with young adults who really don't know mental health services. And I have to admit, I also am a licensed professional counselor. Let me just say, my name is Betty Jean. Jean is the last name. I am a licensed professional counselor, a certified, clinical certified trauma professional. I do private practice as well as run MHA&J's call center. I think the mental health services field can be a little bit intimidating. It's not as straightforward as it needs to be. And so that's why I really do think that our services at the MHA&J is a quality service, because it does walk people through mental health services. Mental health can be very intimidating for those who don't understand it, and services that Mary Jean explained and the ones I'm going to be explaining today is essential to connecting young adults to those services. So I just want to say again, thank you for having us and having me here this morning. I also am an educator. I teach at local colleges, and I teach the very students that we're talking about. The non-traditional students, the students who wear multiple hats, the students that come in and out of college because life just happens. We all know that this is a very particular community. They have their own dynamics, they have complexities, and they require a certain level of attention and care. But to do that, we need to be a little bit versed as to what mental illness is. So what I wanted to do before starting, I never assume that everyone knows what mental illness is or what mental health is. So I just want to kind of lay out the groundwork for what is mental health, what is mental well-being, what is mental illness, because I think we need to, as college leaders, those who are overseeing the activities on the campuses, those who come face to face with students, we need to be clear that we're speaking the same language and we understand what is mental illness, what is mental wellness. So I'm just going to give a brief overview and just kind of walk through some information with you today. So I might not be able to see you because I'm going to switch my screen. Hold on. Thanks for your patience. I feel like I'm on the lines right now, thanking my callers for their patience as we sift through the database. Okay. Do you see that? Okay, perfect. All right, so again, my name is Betty Jean. I am the Director of Call Center Services at New Jersey Mental Health Cares. And today we're going to be looking at us accessing community and private mental health services. When we talk about mental health and well-being, just a working definition, we're talking about the state of well-being in which every individual realizes his or her own potential. They can cope with normal stresses of life. They can work productively and fruitfully, and they're able to contribute to their community. This is the WHO definition. If I were to summarize, I'd say it just refers to one's general state of well-being and state of mind. It has to do with how you feel, how you think, what you believe, how you respond, how you engage, how you relate. Mental health and well-being also helps to determine how you handle stress, how you relate to others, how you make choices, and overall how you cope with life, right? And we know young adults, specifically young adults, we know that this is a very critical stage for them where they're developing in these key areas. What is mental illness? What is mental illness? Let me move this out the way. Mental illness is a health condition involving significant changes in your emotional thinking or behavior. We can say that there is a mental illness when there's ongoing signs and symptoms that cause frequent stress and affect your ability to function. In the clinical world, we look at something as being a disorder once it begins to impair your daily functioning, right? If it's affecting your daily functioning, you're no longer able to do and function and do the daily life tasks the way you used to. That's something that needs to be considered. That's something that needs to be addressed sooner than later. A mental illness can cause problems in your daily life, such as school, work, or in relationships. These symptoms can be managed if they're caught in time with a combination of medication and talk therapy. I never recommend medication without therapy. They do work hand in hand together. And I think that's just something I want to share with you, that it does work together, therapy and medication. As we all know, mental illness does not discriminate. It can affect anyone, any age, gender, income, social status. And I know when we talk about the community college community, we know that some of these communities may be financially challenged, but mental illness does not discriminate. Wherever, whether you're in a 4-year college, 2-year college, the challenges can be the same. Specifically mental health in young adults. I think it's important, like I said before, to know that as young adults, that developmental stage is characterized by numerous transitions, right? They're coming out of college, they're taking on new responsibilities, and we know some of the challenges that they're facing, living situations, they're adulting, right? Identity searches are happening at this time. Also in the young adult stage, it's a time when most mental health disorders, that's when they begin to take root, right? So we all have the unique opportunity to really be able to help young adults address issues that may not have been addressed by their families, may not have been addressed by their caretakers. We have the unique opportunity to be able to help them identify patterns of behavior that they may not be able to see within themselves. So I think we do have a unique opportunity here. Half of mental health issues begin by the age of 14. And by the age of 75% of mental illnesses begin at the age of 24. If you could think of your schizophrenias, severe depression, anxiety, those situations begin right about the age of 24. Just some facts for you: 26% of Americans ages 18 and older suffer from a mental illness. 39% of college students experience a significant mental health issue. This is very important information to know, that the number 2 leading cause of death among young adults is suicide, right? And we know that most people that are suicidal, they are most likely, they were dealing with a level of depression or anxiety. And we know, especially during COVID-19, there was an increase in symptoms of anxiety and depression, but we saw the most increase in young adults between the ages of 18 to 29, which is the group that we're mostly addressing today. What are some of the primary causes of mental health issues in college students? I'm sure if I left it open for all of you, we would all have something to say because we work with these students very closely. But we know that increased responsibilities, that's definitely a cause of mental stressors in college students. Pressure to succeed academically. Financial anxiety. All of a sudden you come out of college and now you have these loans you have to pay for. You have to sign documents that are way beyond your cognitive ability to understand what it is that you're engaging yourself to. So that causes a great deal of financial anxiety, especially if you run out of funds to continue your dreams of going to college. Feeling overworked. Many students in college and community college, they're doing more than one thing. They're not just in school. They're taking care of their families. Many of them may have other responsibilities in their communities, sedentary lifestyles, maybe not yet developing a rhythm for their lives, exercising, which can help with mental health issues. Stigma and shame about mental illness, about mental health challenges that still exists, that still is a thing in 2021. People not wanting to admit that they have a need, that they are struggling mentally. And I think that's something that at Mental Health at MHA&J we continue to address is the stigma surrounding mental health. And we know we have in our national office, our campaign this year was Before Stage 4, with the goal being, can we address mental health issues before it gets too far? If we can tackle it early, it could be managed and the individual could continue to function and lead their lives successfully. Other issues could be biological or genetic. And we also know traumatic events, including sexual assault and racism. I think this is an important point, especially for the BIPOC community in community colleges or four-year colleges. I could remember when I was in college, I came from an urban community, and going into college, and seeing all types of people, that was a very traumatic experience for me, to have to engage with people of different cultures, people that look different than myself, people that had other skin colors than myself. That adjustment was a very difficult one. And I can imagine for many students of color, that is an adjustment that they may not share with you, but it's an underlying current that runs throughout their time in their universities. So again, I'm sharing this because I think it's important that we as leaders, you as leaders on these campuses, that you're aware of just the many nuances of what can cause mental health issues in college students. The community college student, 19.6 million undergraduate students in the United States, 40% attend a two-year community college. Who are the community college students? They're the young adults, they're the working adults, they're adults with children, caregivers, they're the immigrants trying to get a better life, struggling with English, trying to really show that they can compete with the best in America, veterans who are dealing with their own stressors, retirees, those of lower socioeconomic statuses, those with disabilities. I think that I just wanted to kind of give a breadth of who this community college community is. Common stressors of community college students, not to mention that, again, we're talking about a transient community, right? A community that is basically, they're commuters. The sense of community that they would experience at a four-year college, it might not be the same at a two-year college. Some of the common stressors are academic demands, financial demands, relationships and family issues, social support, maybe the lack of, right? You're in a community college, but do you really have the support that you need because you're juggling so many things at a time? Not to mention physical and emotional health issues, health concerns, Those are some common stressors that community college students deal with. Just move my most common mental health conditions that community college students face, and even just young adults, is depression, bipolar, anxiety. And I know you've all heard of that, but these are very real diagnoses, very real illnesses. I often tell people that someone can't just wish depression away. Someone can't just make anxiety go away. Mental illness is similar to any other ailment. It's similar to high blood pressure, similar to diabetes. It's not something that can just go away by thinking positive thoughts if it is not addressed early. But depression, bipolar, anxiety is a common health condition among college students, and suicidal ideation among veterans. I think we underestimate what's happening with our veterans. Sometimes we think of veterans as those who are older, but some of the younger veterans still developing in their brain, having dealt with levels of trauma, to really pay attention a little bit more to that community, because suicidal ideation is extremely high in veteran communities. What are some barriers to accessing mental health care services among community college students? Again, we talked earlier about stigma, the stigma of seeking out services, the stigma of will this affect my career or my academic record? Will my professors look at me different? Will this information be put in, will my future employers know that I was not able to carry my academic load? That could be a barrier to young adults or community college students seeking support. Time. The community college student, their time is very precious. They're doing many things at a time. They have to study, they have to work, they have responsibilities likely with families. They have multiple social roles that sometimes vie for their attention. So sometimes they just don't have the time to seek out mental health services. Their preference is to handle their issues on their own without treatment. And we refer to that as being self-reliant. They just do their best to just cope, manage symptoms of mental illness because there's other issues vying for their attention. And that's something that we really need to look at as a community that supports these students, is how do we create environments where self-reliance is not the go-to? How do we create opportunities for those who feel like they have to take care of themselves, that they know that someone else, there's another system in place to help them and support them? Sometimes barriers to accessing mental health care is based on affordability. Some people, just young people, feel like they don't have money for counseling, or if they don't have insurance, they don't even bother searching for correct information. They just figure, I don't have money, I'm working a little part-time job. The last thing I have money for is to pay $100, $150 for a therapy session. And there goes that idea about counseling. Sometimes they don't recognize the symptoms of mental illness. And I think that's something for all of us. What are the symptoms? If us as adults, we're not clear about it, young adults or community college students, all the more, they don't recognize the symptoms. They may not even know they have an issue. Another barrier could be they don't think treatment would help. There is also a general lack of knowledge, or they're unaware about available mental health services and resources. That can be a barrier. I think part of our conversation today is how does the community college campus increase awareness of services that are available, because these transient students, they need the information right in front of their faces. If they have to go looking for it, especially if there's stigma whether it be cultural stigma, whether it be societal stigma. If they have to go digging for that information, chances are they won't seek out those services. Many people don't know where to go. Many people just have very limited knowledge of mental health, limited information, limited psychoeducative material is extremely important to breaking barriers to mental health care. And then there's currently in this COVID world, there's this fear about counseling, this face-to-face engagement. Some people love this virtual platform. Some people don't like it. So that all of those can serve as barriers. Looking at COVID-19 on our lines, we spent, March of last year to this year, I think it was a whirlwind of a year, but we were right in the trenches of managing COVID-19. Those who were dealing with COVID-19, not to mention our very staff, we were all dealing with the same situation. But for the community college student, I think about some of the challenge they must have experienced, how COVID-19 impacted them. Joblessness and increased financial stress and obligations, that certainly create great challenges during COVID-19, not only for college students, but for many people. The number of people that lost jobs in the past couple of months, overall, we have seen an increase in depression and anxiety over people just not knowing where their next paycheck is going to come from. Students have to worry about that too, because how are they going to pay for their tuition? How are they going to pay for their books? How are they going to pay for gas to get to class or pay for the bus? How are they going to pay for lunch that day, or maybe a bottle of water to drink if they don't have any money? If you have all those financial challenges, it's hard for you to learn and sit in class and focus. Another impact of COVID-19 was parenting. People having to be home and not only having to perhaps learn online, but then you have your kids that you have to assist with online learning, and then you have to work. So the challenges with home stressors and family life, community college students had to bear the brunt of those stresses as well. Grief and loss concerns amongst our students, racial disparities in COVID-19 treatment. We know that there were some racial disparities in the COVID-19 treatment. People of color died significantly at higher rates during COVID-19. So we know that there are certain communities that were afraid to even go outside, afraid to mingle in communities. So that can definitely impact your education. Those with limited English proficiency, undocumented individuals, or those who have family members who are undocumented, all these are stressors. All this, COVID-19 created environments that produce great deal of stress for our students. And then we have the limited access to campus mental health services due to remote environment. What happens when a student is used to going to walking into their advisor's office to sit and to chat and to talk about how their day was? For many students, they lost that for a significant amount of time. Some of them still don't have that. The student who maybe walked into the dean's office just to chat, or the student who just had a place to just take a nap, during the day, because maybe their home wasn't conducive to napping, or maybe in between their classes, they found a safe place to kind of rest in the library. So the limited access to campus really created a situation where it increased the level of stresses that therefore leads to increased depression and symptoms of anxiety for community college students. So how does the community college meet the need of college students in a post-pandemic world? I have about 5 recommendations here. I'm going to just very briefly go through that. I just thought that it's something for us to think about, something for us to mull over. I think these are these are steps, initiatives that you all may be already engaging in already. But in this post-pandemic world, I think we need to be more intentional. I think we need to be more structured in our approach. I just want to start, I'll start with the first one. It says merging academia with mental well-being. Oftentimes there's academia and mental health issues are separate. But what would it look like if we merged those two experiences? What would it look like if professors and faculty were to engage, were to connect mental issues of mental health of their individual students with their learning, right? Before class begins, there's a check-in to see how everyone's doing. Perhaps there's a way to kind of just check in with everybody via app to let the instructor know how you're doing for the day. You know, green light if you're doing well, red if you're not doing well, orange if you're in the middle. At least it gives the instructor an opportunity to really know what the students are faced with. I think it just challenges the stigma of mental health if we can merge academia. You know, it doesn't have to be that if a student is having challenges that they have to be sent to the counseling office, but how can we merge those experiences to kind of say, hey, in the classroom, we care about that your day, we care about the fact that you had a difficult day today, or you're facing certain challenges. Another initiative I think is important is that we normalize conversations and inquiries about mental well-being. What does that mean? That we talk about mental health, that we ask students genuinely, how are you doing? And we follow up. It doesn't mean that you're assessing, doesn't mean that you're diagnosing anyone, but genuine concern, genuine questions. And I think when we do this, we address self-reliance behaviors. Community college students always want to present as they have it all together. They're piecing it all together. But what would it look like if we challenged self-reliant behaviors and created space for students to feel that they don't have to always look like they have it all together. And it's okay to say that I'm not okay today, and create opportunities to provide support, whether it be peer support, whether it be clinical support on the campus, but anywhere we could address issues before they get too far. Normalizing conversations and inquiries about mental well-being will certainly help us to address issues before they get too far. Assisting students with assessing community and private services, direct linkage to community services. I think it's important that we continue to build, the community college community continues to build on their linkage, build partnerships with agencies like Mental Health Association in New Jersey to be able to provide to students, and then making sure that campus leaders, professors, faculty have that information on hand so that they can readily be able to help a student that they're speaking to, and they don't have to send the student on another goose hunt, giving them a 1-800 number. Chances are they're not going to respond to it. But how can we have like a checklist, or maybe a little palm card, or some kind of app that students can readily access mental health services if they should need. Focus on psychoeducation, which is huge. That's one of the things that we do very well on our lines is psychoeducation. Many people don't really understand what mental illness is or what it isn't. I believe that on the college campus, there's opportunities to really strengthen mental well-being through psychoeducation, and also through skill-based support groups, providing opportunities. Maybe all students can't go to individual therapy, but creating opportunities for skill-based support groups, such as managing stress, how to juggle, how to balance your life, or how to deal with symptoms of anxiety, and make it a 3-week or a 3-week session. And come every week and they build community and they learn some key skills to support one another and to also receive support from their college. So those are just some recommendations that I thought that it would be worth discussing if you're already working on that in your particular campus. Kudos to you. I would definitely say continue to build on those initiatives. I would like for you to consider MHNJ as a community partner. New Jersey Mental Health Cares, as Mary Jean shared, we are currently the state's New Jersey Hope and Healing COVID-19 emotional support helpline. We existed prior to the pandemic, but certainly the pandemic has increased our volume and the number of people that the traffic into our lines has been tremendous. But we have a knowledgeable, experienced, and a diverse call specialists who are standing by to provide students with emotional support, psychoeducation, information and referral, listening support, and crisis support. Our staff on the New Jersey Mental Health Cares are all mental health professionals. They're not lay people, they're not volunteers. They're trained people that can provide a level of support for callers and students, whether the students calling for themselves or they're calling for family members. We connect students to mental health clinics, outpatient services within their county, if they have Medicaid, or if they're seeking low to no cost counseling services. There are not that many of them throughout the state, but we do go looking for them because we do recognize that some people don't have insurance. And if we could find those services, we get so excited about those. We do have a database of all types of clinical services available throughout the state. We also we can assist students with navigating their private insurance. If they have private insurance, sometimes people have private insurance and don't even know how to navigate their own insurance directory. We assist people with that. Students can call our number over and over again. They could call several times, and all of our calls are confidential. So I wanted to share that information with you. Here is our number. We welcome students, we welcome the faculty, we welcome staff. So please give us a call. We are here to serve you. We are here to provide support at any time of the day. We're open 8 a.m. to 8 p.m. In the evening. You can also text us at NJ Hope. Thank you for the opportunity to share with you a little bit about our program and how we believe that we can best support community college students. Thank you. I don't know if there's any questions. I'm willing to answer any questions. I know I went fast because I really wanted to make sure I wasn't out of time.
Betty, thank you. Any questions throughout, folks? I know some folks were asking to share your contact information. Betty, if you'll be so kind to share your slides with us, we'll get that out to everyone. And I know those critical resource contacts are in the slides, as you just mentioned. Any questions for Betty, folks, across the board? Accolades coming in on the chat. Great information. Thank you so much. Any questions? Seeing none. All right, Betty, thank you. And thank you for agreeing to join us today and for working with us and all you've done to support our students to date. It would not surprise me that many of our students had reached out to you and your colleagues already. And we appreciate you being with us and sharing this with all of us. We pledge to you to ensure that all of our students have access to this should they need your help and your colleagues' help. So thank you so much. We appreciate it. So folks, what we're going to do again, it is a packed agenda. We'll take a 15-minute break now. We will reconvene at, let's say, 11:05. We'll reconvene at 11:05. So we'll see you folks at 11:05. Okay, welcome back. Hope everybody had a chance to stretch their legs, get another coffee or tea or a morning beverage of your choice. And we're delighted now to welcome our friends from the Mental Health Association in New Jersey, Jamie Angelini and Ruth Kaluski. We're going to talk about evidence-based mental health awareness training programs. So Jamie and Ruth, I'll turn it over to you. Thank you so much for being with us.
Thank you, Jake. It's been a fascinating morning. Very, very excited to be here on behalf of the Mental Health Association in New Jersey. My name is Ruth Kaluski. I'm the statewide director for the Mental Health First Aid Program, as well as the director for the Career Connection Employment Resource Institute. Again, evidence-based practices are something that we've heard kind of a theme about throughout the day. And I love that Mary Jean spoke about supported education and supported employment, because that's an evidence-based practice that we work on at the Mental Health Association. So again, thank you. I also, before I start the PowerPoint, wanted just to say that I think it's been a beautiful conversation. And there were some themes that I picked up on and was jotting down before my turn came up, which really helps me move into our section. I love that Stephanie brought up, and Stephanie, thank you so very much for your insights, talking about normalizing the conversation, which is something that's so incredibly important. And there you said it first off, and my heart sings, because we're trying to get that information out. These conversations should be normal and typical. We should be having them. Keeping quiet about mental health serves nobody well. And the way that you said it was so eloquent, it really, just brought home the kinds of work that we're trying to do at the Mental Health Association in New Jersey. And then Mary Jean talking about how prevention is critical. Again, we get in there early. We help people do better in the long run. So again, that was a recurring theme that I picked up on. And of course, Betty pointing out that was really important is that young people, this is when this stuff starts. We can't wait to see if it's a phase or if everything will turn out okay. We know that signs and symptoms are emerging at very young ages, and being aware of that is going to be super important. So when we get into our evidence-based practices, that ties it all together. So that being said, there's lots of evidence-based practices out there. Jamie and I are going to talk about a few that we use quite often at the Mental Health Association and we think are very effective. Again, we're always open to other suggestions and other trainings, but we're going to talk a little bit today about the mental health first aid, as well as the QPR question, persuade, refer, and give you a little bit of information on those. So I'm going to attempt to share my screen. Aha, there we go. And someone give me a thumb, Jake, give me a thumbs up if it actually worked. Terrific. Okay. So again, the Mental Health Association in New Jersey, we've always worked with community colleges in some way or another. We also work with the universities in the state, community agencies, parents, stakeholders, peers, and we look to provide that evidence-based professional development to faculty and staff to help address the mental health needs of students. And again, helping to address the mental health needs of staff. So we're all in this together. We know that 1 in 5 individuals experiences some type of a mental health challenge in any given year. So that's us, that's our friends, that's our families, that's faculty, that's staff, that's students. So we want to keep that in mind. We also look really, think it's very important to provide those evidence-based mental health trainings for students so that they can learn how to notice and respond when they or a peer is experiencing a mental health challenge or substance use challenge. Peers are sometimes the first person to notice. They see each other every day, perhaps at lunch, perhaps in class, and a peer might be the first person to notice. So giving students the information that they might need to have these conversations and to have the knowledge of what Betty Jean talked about, the resources that are out there that might be able to help them or a friend, is going to be extremely important. So that being said, going along with our theme of having these conversations, I'm going to put up a short video just to give you kind of an idea of what we're looking at in terms of the mental health first aid and the QPR. So if you bear with me a second. Oh, there they are. There we have our flyer on mental health first aid to the left and on QPR to the right. Mental health first aid is a longer training than QPR. Mental health first aid is an overview of mental health and addictions. And then QPR really kind of pulls out and gives us more information surrounding suicide and suicide prevention. So these are the two evidence-based practices that we're going to focus on today. And this is our video that talks about that conversation. So let's take a look at that and then we'll move on.
I'm Danny. I've lived with depression and anxiety for about 12 years. And today I'm going to be opening up about those mental health challenges with some complete strangers in the hopes that we can start normalizing conversations about mental health. Hi, I'm Danny. Nice to meet you.
I'm Colleen. It's nice to meet you too.
Cecilio, nice to meet you.
How are you?
Doing well, thank you.
I'm doing really good, yeah.
Doing good. Yourself?
I'm actually not doing so well today.
Okay, that's honest.
Oh, it's all right.
Okay. So.
Okay.
Okay, what's going on?
Can you tell me a little bit more about it? Do you feel comfortable talking about it, or?
Yeah, I can talk about it. So I've been living with depression for a long time, and this week has been particularly hard for me. So a lot of people simply just don't know what to say and what to do when somebody opens up to them about a mental health or addiction challenge. And that's really where mental health first aid can be valuable. It teaches people a concrete action plan for starting a conversation and getting somebody the support that they need, whether that's treatment or just a non-judgmental listening ear. So was it a little unexpected when I responded that I wasn't doing well, us being complete strangers until this moment?
I'll be honest, it caught me off guard. You just expect the automatic response of, how are you doing? I'm good.
When you first meet someone, here there's like a huge distance.
I always feel like, how can I help someone else? So, and I know it's hard because you just want to be like, oh, sorry, okay, let me run,
And I don't think people do it because they're inconsiderate. I think it's because they honestly just don't know what to say.
Have you talked to anyone about this?
Sometimes I just don't want to burden. Yeah.
I know it feels like that, but most of the time people want to help.
Yeah.
Like everyone kind of wants to be useful to other people, so they want to help you. So
Yeah.
don't feel like you're burdening them.
That was really nice.
That's so sweet. I totally wanted to give you a hug, and then I was like, that might be weird, but okay.
No, that was exactly what you should have said.
Myself, I was thinking okay, this person is in need of help. Try your best. Listen to them. Sometimes that's the best thing you can do is just listen.
If you had cancer, you wouldn't just try to you wouldn't will yourself to get better with that. And so I hope that people just start talking about it more.
Wouldn't it be refreshing if we could take off the mask?
Yes, absolutely. Be real people.
So how did you learn how to respond that way?
My father committed suicide when I was young, and it was a really pivotal change. And I think I spent most of my life trying to avoid that and avoid talking about that and the shame and the guilt. So I really made this decision to learn how to interact with people and be empathetic and show people that someone does care about them even if I don't know you. I think people should just ask more questions, because it's once you get to know the person and understand that it could literally be any of us, any of us could have this at any point in our lives, how could you make a judgment on it?
Can I give you a hug?
Well, absolutely. I love hugs.
Thank you.
Okay. Thank you so much for watching the video. Again, it goes back to everything that we're talking about here, just reducing that stigma, having these conversations. And we have an evidence-based practice out there in mental health first aid that allows us to teach students, faculty, staff, family, community, just kind of how to approach that, to not be so fearful. When we notice somebody has a physical, they're limping on their foot, the first thing we say is, what happened? How can I help you? And we want to make that also true for people who might be experiencing depression or anxiety or be living with a bipolar disorder. Just asking those same questions. How are you? How can I help? And when we get an answer that looks a little different than we're used to, not being a little shocked or walking away, but being there for our friends, for our family, for our students, for our faculty. So again, mental health first aid is an evidence-based public education course. It came out of Australia. It is a full 8 hours of training. It is a certificate that's nationally recognized. It's in 50 states, 20 countries. We love the evidence base behind it. It gives you the skills you need to reach out and provide that initial help. It's basically being kind and how to address some of these issues. I love the video shows you you get surprised when someone says they're not well. We always expect people to say, fine. And that's just not always the case, unfortunately. Just to let you know a little bit of data, there's 2 million people in the United States who are certified as mental health first aiders. So we're out there, everybody, all of us can be mental health first aiders. All of us can do this. It's not something that you need a degree for. Super important to know. And we can also help people as they're having emerging signs and symptoms, but also in a crisis. So again, that's something that we might choose to do with the skills that we learn in mental health first aid. Moving on, what we learn in the class. And again, we're not, Betty talked about that. We're not learning to diagnose. It doesn't matter what the diagnosis is of any individual. We're talking about the care, not the cause. We're being there for the care, right? So we're going to learn some common signs and symptoms of both of mental illness and substance use. And we know sometimes they go together. We're going to talk about how to interact with a person who might be in crisis if we choose to do so, how to connect people with that appropriate help. So all that information we got from Mary Jean and from Betty today, as mental health first aiders, we will be able to share that with our community, with our friends, with our colleagues. And there's more expanded content on trauma and substance use because we've seen that's been a big issue during this pandemic, as Betty had talked about. And then there's also a strong focus on self-care. Sometimes as individuals in these communities and we want to help, we need to take focus and take a step back sometimes to take care of ourselves because we want to be effective in assisting others. So this is kind of your full day training in mental health first aid in a nutshell. And this is one of the evidence-based practices that we use to help individuals who might be who want to help people who might be experiencing or living with mental health issues, substance use, or that combination. So just to give you a little bit of information on the evidence, this is the information that's been studied and documented, and there's always ongoing continuing studies around mental health first aid and its effectiveness. But this is some areas that I wanted to share with this particular group, your academics, so you like that research base. People who take the course grow their knowledge of signs and symptoms and risk factors of mental illness and addictions. So our noticing skills are kind of honed in after a course like this. We start to notice and we start to feel comfortable asking questions. We also have an increased knowledge of resources because in every mental health first aid class, we provide a list of resources. And we have a beautiful list at the Mental Health Association that we're always adding to. So we ask you if you know of any great resources, we'll add that to our list, both on the campus community and in the community surrounding your college. Increased confidence. So we have people who take the class and they feel more confident and they're more likely to help an individual that might be experiencing some distress. Really important information. And then something interesting that's come out of some of the studies is that people who take a mental health first aid class show a decrease in psychological distress, which is a pretty interesting topic if you think about it. Some of the speculation is around, once you take a class, you realize it's common. It takes that stigma down. So if you're experiencing some signs and symptoms, you can talk about it. People sharing make you feel less alone. So people leave the class feeling less alone. Hey, it's not just me, it's other people too. And people can help, and there's hope for recovery. So mental health first aid has a very strong emphasis on hope for recovery, which we at the Mental Health Association always are talking about. People live with mental illness, they do well, they thrive. And we want to see the students in the community colleges also gain from this experience. So if there's any questions, we're going to go through and talk a little bit more about the QPR. Jamie's going to speak for a moment. And then we'll move on to questions about both evidence-based practices and how we might offer that to the community colleges. Jamie?
Thanks, Ruth. So we'll start by looking at a QPR intro slide, just like we did with mental health first aid. And then we'll go over just a couple slides so that you understand, what individuals, faculty, staff, and students are learning in the QPR suicide prevention course. So Ruth, go ahead and put that on, and then we'll talk a little bit.
Research shows that the odds of surviving a heart attack in a public place are 10 times greater in regions where thousands of ordinary citizens are trained in CPR. It's called bystander rescue. When someone shows signs of experiencing cardiac arrest, the response of nearby friends, family, or coworkers is critical. The effective use of CPR doubles or triples one's chances of surviving a heart attack. Like CPR, QPR is an emergency intervention for someone experiencing a life-threatening crisis. QPR is easy to learn and easy to remember, but it takes courage to overcome our fears about reaching out to help someone who may be considering suicide. Research also shows that where QPR is widely taught, suicide attempts and deaths decrease. Just like CPR, QPR requires quick, bold, and informed action. Because suicide, like heart attacks, remains a rare event, we must train hundreds to save one. thousands to save hundreds, and millions to save thousands. There is an old Welsh saying, "No great misery goes unspoken." When we have a toothache, we tell people. We don't hide our pain. But because of the stigma and taboo around the word suicide, many people considering suicide don't speak plainly about their suffering. They fear our rejection. They fear that if they say something, we will ridicule them or make fun of them. As a result, people thinking about suicide often use indirect language. They hint at what they're thinking of doing. They send us coded messages, and they suffer in silence. Called suicide warning signs, QPR training teaches you how to recognize these warning signs, quickly decode them, and then question the person in an informed and compassionate manner to learn if they're considering suicide. Just as talking about physical pain helps diminish it, talking about suicide with someone willing and able to listen reduces psychological pain almost immediately. Trained QPR gatekeepers are merchants of hope, and hope helps prevent suicide. Millions of people have now been trained in QPR. Rigorous independent research studies support QPR as effective, and thousands of personal stories assure us that QPR is saving lives. When you use QPR, not everyone will be suicidal. Some people are simply stressed to the breaking point, but they still need help. Help you can give. Please note that you cannot put the idea of suicide into someone's mind. People are either thinking about suicide or they're not. The fear of putting the idea of suicide into someone's head is a myth that keeps us from acting when we should do just the opposite. QPR is a universal intervention for people in pain, whether they're thinking about suicide or not. While it takes a special courage to overcome our fears, we will teach you how to ask about suicide and to offer hope through listening. Listening is the power tool that restores hope in the hopeless. We know you can do this, and we will show you how. Preventing suicide. It's what people do. Research shows that the...
Thanks, Ruth, for showing that video. So once again, good morning. I'm Jamie Angelini with the Mental Health Association New Jersey, and with Ruth, I'm a trained instructor for both mental health first aid and QPR. I'm honored to be teaching both of those courses at many colleges and universities around the state. So you saw that intro slide, and that's something that we show in the beginning of the course, probably two or three slides in. That's what we show individuals. What we really like about it, when I say we instructors around the world, really, that it's three simple steps that can save a life. QPR. And it stands for question, persuade, and refer. Question is that question, questioning someone about suicide. And in the period of time we're in the class, we spend time helping people build their confidence around asking that difficult question. The P is persuade. We've all persuaded someone to do something, and we talk about it in that way. We're persuading someone to stay with us, to stay alive, to allow us to get them the help they need. And the R is refer. We talk about resources. We talk about how to best refer someone. It would be very specific to your audiences if we're teaching this on the college campus about how we make those best referrals on campus and then off campus. And as you saw in the video, just like people are trained in first aid and CPR, we want individuals who are trained in QPR to learn to recognize those warning signs, to really think about how we help someone, how we move forward. But a big part of that is just recognizing, noticing, and having the confidence to say something. Next slide, please, Ruth. So it's a gatekeeper training. It is designed for anyone and everyone, and it is really comprehensive and concise. So mental health first aid is different. That is a certification training. It's 8 hours. It is packed with information around mental health challenges and substance use disorders. QPR is much shorter. It is a certificate training, and it is really designed to, in an hour and a half, sometimes 2 hours, provide the layperson or professional gatekeeper to understand those warning signs, risk factors. It's broken into a few segments. So we look at verbal clues, we look at behavioral clues, situational, we look at impact slides, and we look at a lot of statistics. We are able to design it so that whoever the audience is at the end of the QPR slides, we build in those specific resources for that audience. And that's what's really nice. Every person receives electronic materials, they receive resources, they receive that certificate. And when we talk about promoting a training like this, we really think about gatekeepers as anyone who is strategically positioned to help someone, which is all of us. So it can be, as you see on the slide here, teachers and school staff, but coaches, parents, neighbors, law enforcement, ministers. So we focus on that idea of gatekeepers being anyone and everyone in our community to be able to recognize those signs and symptoms and to be able to reach out and help someone. So like Ruth said, we know there's other trainings out there. These are two that we've used for many years, two that we use a lot on college campuses. So we just wanted to really highlight those today in the period of time that we have, but we'd love to answer some questions for you. Thanks, Ruth.
Ruth, Jamie, thank you both so much. Just curious across the board, folks, questions for Ruth and Jamie regarding mental health first aid or QPR?
Jamie, there's a question in the chat about how to get trained in QPR. Did you want to address that one?
Yeah, I mean, I think one of the best ways is to reach out to us. I know that Jake is going to forward our contact information. You know, we're working very closely with Jake and Erin, and I feel like if, you know, you want to reach out and work on setting up a training, we can do that with you. I also see a note in the chat that at Hudson, the students are getting trained in mental health first aid. That's great to see. Thanks, Doreen.
You're welcome. Actually, I have a question. The QPR training, is it a live training or is it an online program?
So we can do it either way. We can do it live or we're also doing it virtually. And I should also mention that virtually, we are still using the role play. So if anyone is familiar with doing the live training, we're able to break out into small breakout rooms and really allow people to practice and role play. So we are doing it both, but virtually we've seen it be very effective over the last year with COVID, still delivering it just in a different way.
And with the training, the people that attend, so for my mental health first aid trainings that I've been running, I've been trying to keep it to around 10 to a training group running twice a month. With the QPR, is there a training limit amount of people that should be in?
Yep, we're allowed to take a maximum of 30 people. I think a minimum of 10, Doreen, is probably good, which is what you're used to, just so that we can interact and really talk through some role play, but maximum would be 30, especially in the virtual classroom.
Correct. Yeah, this is a great, both trainings are for both students and staff. So really the idea is to bring up the mental health literacy of the entire campus, which can only be done if everybody's kind of on the same page. So QPR and mental health first aid are both available to anybody over the age of 18.
Yeah, I agree with that. I'm a licensed clinician. I've been doing this for a long time and I did the mental health first aid training. That's how I started to do it. I want to say I learned from it to look at it not from a clinical eye, but from a layman perspective of how to approach someone in a non-judgmental, non-threatening way. It was a good reinforcer. A lot of the staff that have taken it, a lot of the students that have taken it have walked away and said, I feel comfortable now. I'm okay. Even the students, now I notice that students that did the training will call me and they'll say, hey, I'm sending so-and-so to you. I feel like they needed some help. So it's nice to get the students involved with this training, not just staff and faculty, but educating the campus as a whole, because we're creating a campus of being a stigma-free campus.
Wonderful. That's wonderful. Such good points. Thank you so much, Doreen.
I will be in touch because I want to start getting the QPR training and getting it offered to our staff as well and students.
Wonderful.
Thanks.
This is Sheila Dinan, and I am the Associate Dean of Student Success at Hudson. And we had started to do this back in June of 18 on the ground. And I can tell you it was so well received with the first group. The next day after the training, I walked through the first floor of the administration building, and the people who were in that class had their books out there and they were reading the books and they were quoting to other people. So it is very, very powerful to get other people in there, but I think that was incredible.
Thank you so much, Sheila. We're so glad.
Thanks, Sheila.
from campuses. Yeah, we've had a really good experience. There's a lot of people offering it out there. We just want the word out there. We want it offered well into Fidelity. It should look the same everywhere. And that's why I think the results are just so wonderful, and the research, holds water. So that's great that we're hearing that.
Would we be able to put together a train the trainer that might, in order to get to more students and colleges? Is that possible?
So Phil, you're so ahead of your time. You're just there. Thank you so much for asking that question. And, we're working, Jake's gonna have some announcements surrounding that a little bit later in the day, but we definitely want to see that happen.
Yeah, because I've been a strong advocate of mental health first aid for a long time. I think it's what you do is excellent. But in order to get to more students and more staff and more colleges, if maybe through NJCCC and Jake, we can set up some train the trainers, that could really, expand what you guys are doing. So.
Right. And you saying that makes Jake and I and Aaron and my boss, Bob and Jamie, very excited, because that's really the plan that we have. And I'm going to let you announce that later on. But Jamie and I still want to be able to pop over to the college and teach a class.
Oh, of course.
We just love this stuff. And Doreen will help us set it up, because that's the complicated part. But thank you so much for your interest.
That's great.
So much.
That's great. Thank you for everything that you do with this. Thank you.
Mm-hmm.
Is there I'm sorry, is there any research or surveys that you have conducted where you've done like a hard look at statistically shown research that it has made staff feel more confident in feeling being able to be trained? Like, have you done that end of it? Sorry, I want to say that's the other hat I'm wearing as a student, is I want to know the numbers.
Yeah, well, my grades and statistics aren't worth talking about, but I'll tell you that I will send out to Jake for him to pass on. There is a research base, and I have that. And so what I'll do is I'll send Jake the research. I'll have to find it. And there's been a lot more since that, but it looks pretty up to date. And Jake can send that out when he sends out the PowerPoint. And I'd be happy to share that with everybody. That's a great question. Thanks, Doreen.
You're welcome.
Question that's in the chat is, do you provide QPR in every county? I don't want to get ahead of myself, but Jamie shaking your head, yes, the answer is yes. Other questions for Jamie and Ruth, folks?
I saw that Yannick loved she took the classes, and thank you so much for saying that in the chat. So yeah, we love teaching you. Your group was wonderful.
Right.
Okay, Jake, it's all yours.
All right. Well, Ruth, Jamie, thank you both so much for this information, and thank you for being with us and for working with us on all of this and all the work that's yet to come. We very much appreciate it. It's so needed, as we've said, and has been emphasized throughout the event so far today. And we just cannot thank you enough for lending your expertise to us to help us with all of this. So thank you. Okay, everybody. So what we're going to do now is we're going to have a panel presentation to the best that we can. We've got some friends of ours from Hudson and Passaic to join some friends of ours from the JED Foundation to talk a little bit about the JED Campus Project. They'll give us a little overview of what they're doing there. So after about 10-15 minutes, we'll then hear from Christopher June at Brookdale Community College to talk a little bit about a technological solution they're putting into play to help complement their work they're doing on the ground with their counselors. And then finally, we're going to hear from the team at Bergen Community College about their practices on campus and virtually and whatnot, best practices on a campus setting. So I'm going to turn it over now to Ethan Fields at the JED Foundation. Ethan, thank you so much for being with us.
No, thank you all so much for inviting me. And it's so great to see so many friendly faces and people that I've got to meet across the state of New Jersey. I'm Ethan Fields. I'm the Senior Manager of Higher Education Program Outreach and Promotion at the JED Foundation, which is based in Manhattan. So I'm coming to you live from my walk-up apartment in Brooklyn, but just drove through New Jersey last night, coming back from my home state of Virginia. We are going to talk a little bit about the JED Campus Program, give you all just a little bit of a brief history of the JED Foundation if you aren't familiar with us. And then you've heard from Sheila just a few minutes ago and Doreen from Hudson County Community College. And so Sheila is going to be able to talk a little bit about some things that are going well there, what they're hopeful for as engaging in our program, as well as Leah from Passaic County Community College. So I want to pull up a slide deck really quick, and I'll make sure that you all have a copy of these slides. There's way more information in this than I'm actually going to present for you all today. But just as you all have seen from all the great presenters today, we have resources to provide to you all around mental health in your campus communities. So the JED Foundation got started in 2000 after our founders lost their son Jed to suicide while he was at college in 1998. The foundation started in 2000 really to answer the question that the university president kind of posed to the family when they were debriefing everything that happened. And that was what policies and services can a campus really put in place to prevent suicide? How do you put a safety net under your campus? Because we knew that more and more students and young people were being lost to suicide each year. So we started out really focused in that area and continue to expand our scope and our mission as we got started. And so our main mission is to protect the emotional health and prevent suicide for our nation's teens and young adults. So we started off in the college space, but recognized we needed to look at that age group of 13 to 30. Of course, when working with higher education institutions, we're talking about mental health across age spectrums. But just know that at the heart of our organization, we started off as teen and young adults, recognizing again that all folks need to work on mental health for everybody. So we focus in on equipping teens and young adults with the skills to navigate mental health challenges, that it's normal to seek and give help, and that they're emotionally prepared to enter adulthood. And that every college and high school has a comprehensive system that supports student mental health and reduces the risk of substance misuse and suicide. And that, again, we're also engaging our communities and the people that surround young people, so parents and families, educators, media, all folks that surround young people, that we're moving towards destigmatizing mental health, and that we are making it synonymous with their physical health, which folks talked a lot about this morning. I loved Betty's presentation this morning about talking about mental health. So we do our work through a variety of different programs. The first formal program that we created in our organization was U Lifeline, which is an online screening tool for mental health. And so that's similar to some of the screening opportunities that are offered through other state resources in New Jersey, but it's an online screening tool specifically for college students, and it's free for any college to use. And then we started creating a formal partnership program with colleges and universities called JED Campus. And that started around 2013 and has been growing and evolving over the past 8 years. And then this year, we also launched a similar program for high schools called JED High School. And then we have a variety of other free online resources we developed over the years, including Set to Go, which focuses on the transition from high school to college or from high school to the workforce. And so it talks about the life skills preparedness that folks need as they transition through those educational pathways, as you're starting to think about the transition of care as you go from high school to college or the workforce, or if you're, going from New Jersey to attending school in South Carolina, wherever it may be, and how to think about transitioning your mental health care over that time. And so there's resources not only just for students themselves, but for guidance counselors and school staff and parents and families. And then we have a variety of campaigns. So I know there was that great video that you all put out for mental health first aid and QPR, that awkward conversation one a few minutes ago. So we also have a campaign called Seize the Awkward that we did in partnership with the American Foundation for Suicide Prevention and the Ad Council, that focuses in on teaching young people how to seize those moments to have that conversation with a friend they may be struggling, giving them conversation starters, how to maintain that relationship through those conversations. And then a few other ones, such as Half of Us, which we did with MTV, which is now called Mental Health is Health, that was recently released. And then Love is Louder is one about anti-bullying and really about self-love and compassion. And underpinning all of our work at JED is our comprehensive approach to mental health promotion and suicide prevention that we developed early on in our organization's history alongside the Suicide Prevention Resource Center. So this is an evidence-based approach drawn from the United States Air Force's model in the 1990s. That was one of the most well-researched approaches to suicide prevention that also led to other positive outcomes within a boundaried community. So whenever you look from suicide prevention from an upstream public health approach, enhancing protective factors, having strong interventions, as well as a focus on postvention and means restriction and safety, you can really start to make big changes across your community. And so we adapted it to the college and university space. We also have a similar version for high schools with just a little bit different language because those environments are a little different. And then we wrap those 7 domains here into 2 other areas. So strategic planning, so that mental health is and emotional health is a priority for the institution. The same way that we talk about academic preparedness, that it's synonymous with our institutional health. And that we think about it from an equitable implementation lens, recognizing that you can't separate one's identity and journey from mental health, and that we have to acknowledge the systemic issues, especially around racial disparities in our country, as well as any population-specific information related to our students or our surrounding communities that may affect our access to mental health, our knowledge and attitudes and beliefs around mental health. So we really focus in on data there to be able to think about population-specific strategies for a campus community. And those 7 domains, again, that you see on this screen start with developing life skills. So everything from resilience, mindfulness, stress reduction, interpersonal effectiveness. And then we focus in on promoting social connectedness on a campus community. So how do students get connected to their peers, get connected to faculty and staff? How do we address loneliness and isolation? As we know, those are 2 major risk factors for suicide. And then we look at the systems themselves. So how do we identify those at risk, and how do we train through gatekeeper trainings like QPR, mental health first aid, our entire campus community in being able to recognize warning signs, to respond effectively and empathetically, and then be able to refer or respond in that moment with that person. How do we increase help-seeking behavior in the students themselves? So how do we destigmatize mental health? How do we make sure that they know where to get help? And so I know there's a lot of conversations this morning about all the different numbers, all the different services. So how do we make sure that folks know clearly like where you should go and when? And then how do we look at how a campus provides some level of mental health and substance use related services on campus and in the community? So we look deep into the college's systems, because even amongst your all's membership at NJCCC, each campus provides services in a different way. It may be one person, it may be a few folks, it may be only referrals to the community. So how do we look and strengthen that we're best supporting students? And then how do we follow crisis management procedures and really focus in on postvention when things do happen? And then how do we look at means safety and means restriction in our physical environment, as well as being able to educate our students and their parents and families and those they may live with around means safety when it comes to suicide prevention. So that's the underpinning of all of our work. And one of the main program I wanted to talk about today is our JED Campus program. We work with over 300 colleges and universities nationwide through this program. We're starting this month, we'll be working with around 360 some campuses across the country. And there's 2 different versions, but the main one that I'll talk about today is our 4-year JED Campus program. And so in this program, we partner with that college or university let me do this slide, to build a team of stakeholders from faculty, staff, administrators, and students that are going to focus on mental health and well-being. That team conducts a self-study of the college or university's programs, policies, procedures, services related to our comprehensive approach to identify strength areas and gaps. We also conduct a survey of the students themselves through a tool called the Healthy Mind Study to better understand what students are bringing to the table, what their lived experiences are, what their knowledge is around mental health, what their knowledge and experience has been with services on campus and in the community, to be able to inform a collaborative strategic plan that we co-create with that campus team. So the strategic plan is around 80 some different action steps that campus will then implement over 2 to 3 years with dedicated guidance and resources from JED, including a campus advisor, and our ever-evolving learning community of those 300 plus institutions, a playbook of around 500 to 600 resources, and connections with campuses that are doing the work. And then we wrap that 4-year program up with a post-assessment phase internally, like we do in year 1, to look at, after you've been implementing this strategic plan and we've been tracking that progress, what all has been completed programmatically, service related, and then another survey of the students to be able to say, did those changes that we enacted on this campus result in any positive outcomes in the students? And then we wrap that up in a sustainability plan, because as we know, this work is ongoing. You can't just do a 4-year program, or in the case of our shorter program, which is 18 months, and that it's all over with. But how do we create this collaborative strategic planning process at our institution? And so we worked with a few different campuses across New Jersey. We have some that have finished our 4-year program, so those are listed on the right there. And we have a bunch that are actively participating in our programs. But thanks to the funding from the New Jersey Pandemic Relief Fund, we were able to sponsor 3 new campuses to start this fall in our 4-year program. And that's Hudson County Community College, Passaic County Community College, and New Jersey City University. And so we're really excited for them to start our program this month. We've been onboarding for this past part of the year, and they're really going to start kicking off the Healthy Mind Study and the assessment process and team building this fall. And let's see, what's the last thing I was going to show? The theory of change. So the way that we built this program to help college and universities is, again, to increase the college system support for students. So our strategic plans look at all those programs, policies, and processes that we've known to make a difference to support students, and that through enacting those changes that the students report more access to care, and that they're improving their attitudes and behaviors around mental health, substance use, bystander intervention, and that relates into positive life outcomes for them and positive institutional outcomes. So we want to see lower likelihood of dying by suicide, lower substance misuse, increased positive mental health. And what we've been noticing after tracking the data of our campuses that have engaged in this process, we're starting to see increases in the institution's retention and graduation rates because of this process. So there is a fee for our programs. Like I mentioned, the New Jersey Pandemic Relief Fund was really helpful in covering the cost of our campuses to participate in this. The 4-year program for community colleges is $36,500. And then the 18-month program, which is essentially the first 18 months of the 4-year program, is $14,000. But just know that if your campus is ever interested in joining this program, we are really good at going out and finding collaborative funders and grants to help cover the program costs, as well as having a financial aid that can help discount those costs. So I know I threw a lot at you all. I'll be sending you all a follow-up on this, and I'll put my contact information in the chat. But I was going to turn it over to my 2 friends at the 2 community colleges to kind of talk about, again, what they feel like they're doing well on their campus already, some gaps that they're hoping to address through this program. So Leah, would you want to kick us off, and I'll stop sharing?
Sure. Thank you so much, Ethan. Hi, good morning, everyone. My name is Leah Travers, and I am I'm a licensed clinical social worker, and I'm the coordinator of student advocacy at Passaic County Community College. This department is dedicated towards assisting students with everything ranging from mental health to food insecurity, homelessness, basic necessities. We sort of term it as everything that impedes their their success or presents an obstacle to their success. The department turns 2 this week. So this is our 2-year anniversary of existence at Passaic County Community College. So that means I turned 2 at the college as well. So it's been really exciting. I feel like it's gone by in 5 minutes. The pandemic really presented a lot of challenges, but it also highlighted a lot of needs. So I guess the silver lining for my area here at Passaic County Community College of that whole experience was that we're seeing now that we desperately need more of a presence for resources and for mental health awareness and for assistance with these things. So what we're really focusing on is sort of like a short-term solution focused model. I see students, in a, clinical, capacity, only 3 or 4 sessions at most, and sort of help them set up an access plan to agency care in the community. And we're really working on food insecurity. We partner with the cafeteria here and the Honor Society to provide a meal distribution program, which then we kind of provide sort of like case management and wraparound services to everybody who participates in that program. We recently got a grant and a donation for a year's worth of feminine care products. So we're also going to be distributing those. And we're working with the One Stop with the Career Closet program. So yeah, we're really, we had to kind of take a hard left with the pandemic, with the virtual, but we're starting to see the students again in person. So that's really been great. And we're so excited to be part of the, to have Jed come and help us, examine what we're doing and expand upon our services and develop, a more comprehensive and just improved service delivery here at PCCC. And we partnered with financial aid and the bursar to help disseminate the CARES funding that came to the students. That gave us access to just about everybody who goes here because everybody applied. That helped us really hone needs and access students, really reach students. Because being a new department, students don't know I'm here. So we really utilize that to get that database, do blast communications, utilize our social media, utilize the email to access students. And as a result, since being here this year, I've interfaced with close to 1,000 students for one reason or the other. And I think I really attribute that to the collaboration with media and marketing, financial aid and bursar, just to help me really access the students, to really, be able to talk to them. So that's it.
Thank you for that, Leah. And I think, that's a great example of like, as you're thinking about increasing the help-seeking behaviors of your students, is that mental health related services can't just be relegated to the people that just one office or one area. Again, it has to be a community-wide effort. So thank you for that. And then Sheila, we were going to let you speak a little bit too about Hudson County Community College.
Thank you, Ethan. I want to thank Ethan and the Jed Foundation for procuring the grant from the pandemic fund. I also think that this is a great opportunity for us at Hudson and our collaboration with Passaic at this point in time as we start to grow into this whole project together. The pieces that I hear and see through all of my prepping for the Jed Foundation is to give us the resources and the ability to do strategic planning, so how we can continue to provide for our students across the board. When the pandemic closed us down, we did not flinch at all as far as what we did. I had hired Doreen the September before, so she was brand new and we were trying to set up everything. But for us, I see the pandemic as a silver lining because we have done more through the remote access and uses of telehealth, group therapy topics, which were often led by students or peer leaders. We have done one thing that really helped us out. And when I was talking to Leah last Thursday, she has done it too. Doreen is a licensed clinical social worker, but she's also a supervisor and a graduate school supervisor. So what we did was we contacted Rutgers and we contacted NYU, and each semester since we have had at least 4 interns, graduate school social work interns, who would be supervised by Doreen, which then it gave us much more outreach for our students. It helped the graduate students, but it also helped our students. And those graduate students were wonderful. They're technology savvy, plus also taking care of groups and doing their individual clinical. That enhanced us in a way that we could never have provided services before. I think this is something that may be worthwhile. As a former grad instructor, we could never find enough placements. And I think this is something we should look into. The other piece that I think is that whole thing that Ethan talked about, strategic planning. We sometimes as social workers, and my background is in crisis intervention, we jump to take care of the crisis and the intervention right at that point in time, but we need to plan for after the crisis and where do we go and what do we do for and with the students who need the help. And I think that is one area that most of us have the most difficulty trying to find community resources, either free or limited or unlimited. And the other major piece that is very difficult is that we may send a student to the hospital, and once they're discharged, they're referred to someplace else and they often don't follow up. They also don't follow up on medication, or they might get a trial on medication, they don't follow up on it. So they're almost on a roller coaster going up and down in their stability. I think we can start to look more to go to outreach with, now New Jersey, for most of us know, is the pharmaceutical capital of the country. I think we should be reaching out to some of these pharmaceutical companies to start looking at how can they help us and how can we help them too, to make sure that the medications that the students may need would be available. I think Jed will give us a great framework for this strategic planning. And just having everybody here today, I think we are going to support each other now that we have been brought together. And I want to thank you all for everything that you have done today, and let's keep going.
Sheila, Leah, Ethan, thank you so much for sharing, for the updates from your campuses on practices currently in play, what more we could be doing, and the overview, Ethan, from the JED Foundation on the JED campus program. I'd like to turn now to Christopher June, the Executive Director of Student Services at Brookdale Community College, talk about another innovative idea the folks at Brookdale are putting into play. Christopher, thanks for being with us.
Thank you for having me. Good afternoon, everyone. I can officially say that just as the clock strikes noon. My name is Christopher June, and I am the Executive Director of Student Services at Brookdale Community College. I'm going to start sharing my screen, and hopefully everyone can see that, right? Good. Okay. I want to talk to you a little bit about Talk Campus. Before I do that, I just want to give you a little bit of an understanding of what our current structure looks like in terms of and wellness support. We have 4 faculty counselors who are licensed mental health professionals who provide crisis service to our campus, as well as short-term support and assessment and referrals to off-campus resources. So that is, kind of the boots on the ground that we have. But in order for that to work, we have to have a lot of partners and a lot of support services to refer our students to. And one of those is Talk Campus. So I want to talk a little bit about what Talk Campus is. It is a peer-to-peer support network. So it's kind of, you can think of it almost as a social media network where students can go to get support from their peers and, also provide support to their peers as well. It is, really a two-way street. It is anonymous if students want to post anonymously. That is, a choice that they can make. But we know a lot of students do, as we've discussed, maybe have some stigma around mental health or, are not comfortable maybe admitting that they have an issue, so that anonymity can give them, a little more secure feeling. There is 24/7, 365 safeguarding, and I'm going to talk a little bit about what that means in a bit. But that was a big part of this for me, making sure that if there was an issue that it could be handled quickly and appropriately. One thing that I wanted to note is that Talk Campus is not counseling services in a box, okay? This is a company that is based out of the UK that provides this service to colleges and universities, but it is not gonna replace or really offer any kind of comprehensive services, in terms of replacing those boots on the ground that we've been talking about and all those other services. So why did we decide to go with Talk Campus? I have to give a shout out to Hudson County College and Doreen. They were one of the first, if not the first, to be using this service in New Jersey before Brookdale was. And Doreen and I did get to chat a little bit about her experience and the great ways that she was really utilizing Talk Campus as a service to their students. So I did want to let you know about that. But as I was talking about, it's a tool in our toolbox, right? This isn't looking to replace anything, but it's another service that we can refer students to or that students can find out about that can get them connected with some support around mental health and wellness. And then hopefully, if they do need additional support, can help get them connected with that as well. Again, I talked a little bit about the safeguarding. That was important to me. I have some more details about that on the next slide, but just really making sure that it was indeed a safe platform for our students was important. And they do a really good job at making sure that there is 24/7, 365 support from licensed mental health professionals should students need it. And I think one of the biggest things is accessibility to students. We've talked a lot about the stigma around mental health, about how students may not feel comfortable or may feel guarded in seeking that type of service in person, or maybe even admitting or realizing that they might have a mental health issue. But this is a familiar platform to them. They can download an app on their phone and really, start accessing the support network right away. And that's something that's familiar to them. So that's another big piece of why we decided to go forward with partnering with Talk Campus. As I said, safeguarding was a big thing for us. They have 24/7, 365 monitoring from licensed, trained staff, and that's supported by things like artificial intelligence and trained peer supporters. So if there is an issue identified, or if there is an issue in the service, the folks that need to know find out as soon as possible. There are also community guidelines that address any inappropriate comments. So it may not be a student at risk, but a student that maybe isn't, supporting the community or providing in a positive way. But I do like the fact that they don't just kind of get rid of them. They work with that student one-on-one to maybe address why they're acting in that way and help them understand how they can be a more supportive member of the community. If there is a student at risk, there might be a threat to themselves or something like that. They are temporarily removed from the peer platform and immediately receive one-on-one support from a clinical staff member. And again, that's something that is available 24/7. And if and when you do partner with Talk Campus, they work with each school to set up what that would look like in terms of getting that student support locally, and also what information they will share with you as the institution about any kind of crisis or at-risk students. So they are really good at making sure you understand the safeguarding and making sure it is specific to your institution and the resources that you have. They really want to make sure they meet you where they're at. Some of the benefits that I've noticed, as I said, it's not an out-of-a-box counseling services solution, but it is an out-of-a-box solution. You're partnering with a company that provides these services. Obviously, there's a cost associated with that, but they are really the ones doing the heavy lifting, and you work with them to determine what part you're going to play in it. And there is a big part to play, and I'll talk about that in a minute. But in terms of the services, they are really providing all of that. There's a wide array of reporting and support services. Talk Campus really, when we were, getting ready to start using this as a service, were really supportive in making sure it fit Brookdale's unique needs. They develop a Brookdale or a school-specific landing page and all sorts of things. The app is specific to your institution. And they also provide a lot of reporting information. Who's utilizing the app? When are they utilizing it? What types of things are they discussing on it? How many crisis situations arose, that kind of thing. And that's shared with you regularly as a user. As I said, there's the active part of it, which is kind of the social networking and support, but there's also passive features, things like journaling, like sleep tracking, information about nutrition that students can also access when they're in the app using the service. And another good thing is that they, as part of the app, they will include whatever information you want to include about your services. So it can kind of be a two-way street. If a student's working with one of Brookdale's counselors, they might get referred to this service. But if a student comes across this service on the website or as part of new student orientation, and they go in and start utilizing it, there's already built-in information about Brookdale's other support services in there that they might then be referred to. And as I said, it's a platform that's familiar to most students. They're used to social networking. They're used to doing things on their phones. And another good piece of this that you might not automatically think of is that they will provide training to peer support specialists on your campus. So right now I am partnering with our Psychology Honor Society and our Human Services students who are going to get trained by Talk Campus to act as peer support specialists in the app. Again, they don't do any of the serious work with at-risk students, but they can help moderate, they can help keep conversations moving, things like that. And they're another set of eyes in case there is an issue so that it can be escalated quickly. The biggest challenge for you or anyone that utilizes this is going to be getting the word out. You sign up, you get it, that's great. But then as with everything else, how do we let our students know that this is a service we have for them? We started we got access to the service right at the end of our spring semester. So we've been using the summer students kind of as a pilot. We did some targeted emailing to them about the service. It's of course on our website and things like that. But we are also partnering with our internal marketing department who Talk Campus is also working with to figure out how we're going to make this really more well-known once the fall semester begins. Our students are going to be back on campus. We know they're going to need some additional support. And that's another benefit, at least in my eyes, that Talk Campus has been willing to meet with our marketing folks and really help us develop a solution unique to Brookdale on how to make sure students find out about this and use it. The one other challenge, I think there is some confusion out there with other services. There is, we got some summer campers going by behind me. There are some services out there where you can, essentially FaceTime with a licensed clinical professional and receive, therapy. That is not what this is. This is, again, more of a peer support network. So, those services do exist out there, but I really think this is a bit more of a fit because I think it's more accessible for students. Again, those that have that stigma or fear of even working with a counselor, this can be a really good first step in helping address some of that stigma. I wanted to share some facts and figures from Talk Campus as well, and this is accessible to anyone as part of, on their website. These are some of the categories, or the most often talked about categories on the app. Obviously, we see a big one is mental health, but also things about relationships. I'm a Title IX person, so that healthy relationships is a big thing for me. Also things like friends, education, uni life. They're a UK-based company, so I appreciate seeing those little nuggets in every once in a while. But even things like physical health. This I wanted to share where students go that are currently using Talk Campus, and this is just globally, not Brookdale specific. Where are they going for additional support? Only 15% are in touch with their place of study. So if we flip that number, it means 85% aren't. So I think that that's a huge kind of thing to realize, that there is a big group of students out there that might benefit from a service like this that aren't coming to the campus to get that help, whether they don't know it's there or, again, because of the stigma. That's something to really be aware of. And another thing that I really thought was important to note, that since using Talk Campus, it seems like a lot of the users really do seem to feel like they can then go find help if they do need it. Again, the Talk Campus network might be enough for a particular student. For another student, they may need additional support. And Talk Campus is not shy about getting that support to the students. They want the students to be aware of the other resources that exist out there. And again, I think this is potentially a really good gateway for a lot of students to get familiar and comfortable with talking about mental health issues, and then maybe taking that next step in reaching out to an on-campus counselor or a resource in the community or something like that. So that is, just kind of a brief overview of Talk Campus. I'm happy if folks have additional questions. I know some folks have reached out already about what it's like setting up with them, what kind of support you can expect. I'm happy to meet or discuss with anyone about any questions. And Jake, I don't know if we want to do any questions now, or if we want to move on. Either way, I'm fine.
Thanks, Christopher. What we'll do is we'll hear from our friends at Bergen Community College, and then we'll have a little bit of time for Q&A as we wrap the event up, if that's all right with everyone.
Perfect. Thank you so much.
See any pressing questions in the chat at this moment. But Christopher, thank you for sharing all of that and the work you're doing at Brookdale to get this service into the hands of students to help complement the work that you and your team do to support students. So thank you for being with us today. We appreciate it.
Thank you.
Now I'd like to turn it over to the team at Bergen Community College. I believe I'm handing it off to Jennifer Reyes, the Dean of Student Supports. Am I correct on that, Jennifer?
That's correct.
Thanks for being with us, team. Appreciate it.
Thank you for having us. So yeah, thank you. This is excellent today. Thank you so much. Much needed information. We're really excited. So I'm Dr. Jennifer Reyes, and I'm the Dean for Student Support Services at Bergen Community College. And on this call right now is also several of our personal counselors. We have Dr. Stafford Barton, who's a personal counselor and also academic counselor, Professor Purcell, Eileen Purcell, who's one of our licensed clinical social workers. We have Professor Peacock, who's also one of our personal counselors. We have a counselor, our licensed clinical social worker, Randy Dodd as well. And then we also have our Director of Disability Services, Tracy Rand. Today, we're going to talk about all of our support services and some things that we're doing on our campus, best practices, and a lot of the things that our colleagues talked about today. So I'm going to now hand it off to Professor Purcell and Dr. Barton to kick us off. I hope they're there.
Eileen, you're muted.
Thank you. What we do know pre-COVID, what we know is that 1 out of 10 pre-COVID, 1 out of 10 students was so depressed, overwhelmed, that they could not function or get out of bed. That meant they weren't coming to school. Post-COVID, during COVID and now, it's 2 out of 10 students is suffering. So we're dealing with some very serious psychological mental health issues. And what we know is one of the latest reports out of the Mental Health in America report, that 79% of the 18 to 24-year-old students admit to moderate to severe anxiety. 79 and 86% admit to moderate to severe depression. Of that group, 37% reported feeling suicidal half a day and even up to a full day. So we're dealing with some very serious issues. Now, I want you to know that during the pandemic, we didn't close down. We kept going and meeting with students, and we logged in about a 13, 14-month period, thousands of hours of work with our students. Now, keep in mind, some of us are doing academic counseling as well, and working with students who are struggling with their academic goals. So part of our job, my job as a full-time personal counselor, is to support those academic goals, keep students in school, and help to preserve their mental health and enhance their coping mechanism. What we do, which are for sure strategies, is we've engaged the professors. So we've got the professors involved. They're the front line. They're the ones who observe and then refer students to us. So we want to catch the students before they fall through the cracks. We present at every opportunity before faculty development to get our name out there so that we can publicize our programming and our outreach effort. In addition, we also keep details and logs of what the students are coming in for, what they're experiencing, and then we format our activities, our workshops, our seminars around what we're seeing. So consequently, we've had great success with leading, and I've done that with Dr. Barton for years, and anger management. We follow a book and we do it for 6 to 10 weeks of anger management. That's been incredibly successful. Also, grief, loss groups, anxiety, skill development for managing stress and anxiety. Professor Peacock has done wonderful workshops on boundaries. Many of our students have no idea what clear boundaries are. And most students, and I'm sure I'm speaking to the choir here, they don't know what a healthy relationship is. So it's a real eye-opener to realize that they have been in an abusive relationship. Many also do not know what sexual assault is. So we've done that as well. In addition, what we do is we send letters to the faculty. We have a large population of adjunct faculty. So they haven't heard our spiel. So we haven't a chance to talk with them via letter, email, to let them know what the signs and symptoms of depression and anxiety and possible suicidal students are. So they will know who to contact and the reasons why. So we raise their wellness as well. And then we suggest that they add to their syllabus a paragraph about how mental health issues are very common on campus, and to think about and refer either a friend to us. We've done so many other things. We've done depression screening, anxiety screening. We brought in the Crisis Intervention Center to sit with us while we do suicide screenings and depression. We put ourselves out there for every club event. We're out there with candy and information about who we are. Did I leave anything out, Stafford? Oh, we've done stress. Oh, Stafford's idea of doing this is fabulous, guys, to have therapy dogs come in on campus. It is a fabulous success. Students love it, and the trainers who come in are really very good. So it's an opportunity for us to, again, put ourselves out there. We have stress balls, we've got pencils, we could do a stress survey, so students can actually see that what they are struggling with is real. That anxiety, that stress, the sleeplessness, the anxiety, the tension, the irritability does mean something, and it's not normal. How'd I do? Anything else? Did I leave anything else out? I'm looking at my notes.
We'll talk about mental health first aid.
Yes, we've been doing, and I checked it out, we've been doing mental health first aid for over 6 years. We were trained the trainers by the Mental Health Association of Maryland in Washington, D.C. And I gotta tell you, it is grueling. It's almost like, it's grueling, and very good, very educational. And we brought that home with us, and we have been lucky enough. I'm trained, Lois Carmichael is trained, and we have a couple other faculty members are trained. We have every year, twice a year, we present to the new nursing students who are coming in. We've presented to the criminal justice students. We also leave it open to faculty and staff. So we've always had, a full house. We've presented up to 50 people at a session. And the students and faculty love it. They really do. And they walk away with just a wealth of information, plus the book that somebody else mentioned, which is just chock full of really good, solid information. So we're doing everything we can to reach out to our students and let them know that we're there. What we're seeing is an incredible amount of loneliness, desperation, lack of contact, lack of connectivity. And the students crave that one-on-one. They crave being part of a group. And we have a lot of clubs on campus that brings a lot of students on campus to feel part of something, because we're a community college, right, guys? So we are our community, and we emphasize to students that you are the community.
And I'm going to piggyback off of your mental health first aid. We also have been offering QPR, I think, for the last 3 years. We were lucky to be part of a grant, Mental Health Awareness Training Grant, through the Division of Mental Health and Addiction Services. So we have Wendy Chin, who's been coming to campus and also doing it virtually to train our students. So and someone mentioned that peers are really our first line to talk to other peers. We started with training our peer mentors and our PTK students as well. We move on to staff. So we've done QPR training for staff as well. We did faculty starting in May, and we're going to continue to do faculty in May as well. And we're looking at clubs too. So we're really trying to train the gatekeepers to be aware of signs and symptoms. Also wanted to get into our wraparound services. We do have a food pantry on campus. Right now, it is run by and managed by the Center for Food Action. However, in the fall, we are moving towards a student-run food pantry supported by CFA. So CFA will still provide the food, but our students will be running the actual pantry. So we're excited about that change, and hope that will bring in more students, more awareness of food security on campus, but where our services are. In addition, we do work with a lot of community resources. We have a really good relationship with the community. So in addition to CFA, we work with the Bergen County United Way for students who are onto the utility bills, really anything that serves as a barrier for them to come to school and continue in school. We work with United Way and our foundation for funding assistance. We offer books through the foundation. So there's a book fund that students come to us. We discuss their concerns, and we are able to assist them if needed with books. We offer ShopRite food cards, food vouchers for the cafeteria. So we really have been working on wraparound services for quite a few years, and I think it's going pretty well.
And also the CARES Act too, right, Stafford? You were heavily involved with that.
Yeah, and Jennifer.
The CARES money, which was wonderful. It was really terrific. Not a lot of people knew about that. And then I think if Jessica Peacock is here, she's going to talk about a lot of stuff we do for our veterans.
Absolutely. Thank you for having me. My name is Jessica Peacock. I'm a licensed clinical social worker. I lead in the footsteps of my colleagues and my mentors here. That we've talked a lot about some of the supportive services we offer. I'd like to also touch on the preventative and the awareness events that we partner with various departments on campus. As mentioned, we work with a lot of our off-campus supports. And these departments, our Veterans Office, our Center for Peace and Justice, Student Government, our student clubs, like I'm sure many of your institutions do as well. But we are asked and we seek to be involved in these events and awareness workshops connected to themes related to Heritage Months in response to the racial injustices. We also work with our mental health awareness events. So I'd like to give a shout out to two of our counselors who are not here today, Professor Jaimo, who's part of our Veterans Office, as well as Professor Christina Hato, who's really spearheaded events with our Center for Peace and Justice. So if this speaks to the collaboration that we have on campus, as robust as this sounds, we're always looking to do more and engage and improve how we can reach our students, like many of you are saying. And in the fall, I see that our events, many or most likely will move to a hybrid format. So continuing to offer some online as well as in-person events as we've all tried to navigate these very weary waters of COVID-19 and our health and safety. So I would love to kick it back to Dean Reyes, just to talk a little bit more about some of our additional services.
Thank you, guys. So I wanted to talk a little bit about our behavioral intervention team. A lot of times when we think of behavioral intervention or early alert, we think of conduct. We run it very differently at Bergen. We have many different people around the table. I mean, we do have student conduct there. We also have public safety and our sheriffs, but we come around together as a team that really cares about our students. So this is not a crisis emergency response team. It's rather, it seeks to implement proactive strategies before the situation becomes a crisis. So this team meets weekly and we identify and coordinate support systems for students who come to our attention, whether it's through a friend or whether it's through a professor. And we've had the BIT since 2011. Actually, no, I'm sorry. 2007. I'm sorry, I'm looking at the wrong note. And these are students that are just showing serious emotional stress, behaviors that are disruptive, harmful to themselves or others. And we're providing the support system through the counselors, the Office of Disability Services, and public safety as well, to get these students to persist and to retain them and to help them be successful. So we really look at the BIT and early alert as positive, not something that is a punishment. And lots of times, it's been wonderful. We've seen students really do well with this. We've had even professors contact us after. They were a little nervous about reporting, right? They're afraid. Sometimes they're afraid of our students. But now I have one professor who got back to us. It's a communication professor, and she just wrote, "I'm a huge believer in this early alert system and how it allows for early detection and intervention." She wrote this to us, thanking us that one of her students went from failing to a C+. That's huge. All because she reported early on, let us know what was going on in the class. And she took, the student took the counselor's email seriously. We're into intrusive intervention. We'll go into the student center. We'll call them on the phone. We approach them in a positive, caring, compassionate way. It's not about anything punitive at all. So that's one of the major programs on our campus that we do every single week and that we're quite proud of. I'm going to kick it back to, I'm going to kick it to one of my faves, is my director of disability services. Many of you may know her, Tracy Rand. She's quite known in the state for disability services. Quite proud that she's at Bergen.
Thank you,
Tracy.
Dean Ray. Thank you. I'm just going to piggyback off all of the wonderful things. Oh, the screen went blank. Can anybody hear me?
We can hear you, Tracy.
We can hear you.
All right. And again, all of the resources that we're sharing here today, We collaborate. All of these offices collaborate. So as Director of Disability Services, we're that connector to provide students with accommodations, but also make sure that they're aware of the resources that are available on campus. And as COVID hit us in the spring of 2020, what we found was more students that were at the college were self-disclosing. They were self-disclosing, having increased anxiety, levels of depression related to the pandemic or impact of having COVID or a family member having COVID, and trying to not only determine whether or not accommodations were going to be appropriate for them, but making sure that they were connected with different offices and resources that were available through the college and our community to better support them. And again, a lot of what Dean Reyes and our team has been sharing is, we try to be a hub. We try to make sure that we're aware of everything that's around so that we can connect our students and anyone within our community here with the support that they need in order to provide them with a more successful outcome. How we did that during COVID was scheduling workshops, trying to gather information from students, but also from faculty and staff about what the need was, and then working with various areas within the college to provide those supports. So some of the things that we did was related to technology, but we also did a workshop through professional development for faculty that focused on the impact for students on the autism spectrum. So we have had a long history at the college through disability services of connecting with our personal counselors, and we're very fortunate under Dean Reyes's direction to have 2 personal counselors that are directly connected with disability services. Professor Peacock being one of them, and Professor Carmichael, who unfortunately couldn't be with us today, is the second. So in addition to providing academic and accommodation supports, we also have access to licensed personal counselors through our office that can better support our students. What we found is another great resource has been connecting students early on with personal counseling. So we have the ability through our office to assist with scheduling appointments with the personal counselors for a variety of issues related to their mental health diagnosis, but also connected most importantly with their goals here at the college to make sure that they are connected with support, whether it's on campus or off campus, to assist them in getting that best outcome. In addition to my role as Director for Disability Services, there's a program that sits underneath our office that is called Turning Point. And Turning Point is a program for students with intellectual and developmental disabilities who would not be studying for a credit-bearing degree or certificate. This program was developed out of a grant through a Department of Education opportunity the college had in 2010. We have been recipients of this grant for the last 10 years. And the goal of this program is to provide students with an inclusive post-secondary experience that provides them with job training and the ability to become employed in an area that's going to allow them for growth and greater inclusion within the community. So those are just a few of the things that our office does. I'm going to turn it back to Dean Reyes. And thank you for the opportunity to share this information with everyone today.
Hi, everyone. This is Jessica Peacock. I'm going to jump in as Dean Reyes had to step out. So again, I'd just like to reiterate what my colleagues and my mentors are saying for Bergen Community College. As a newcomer to the NJCCC, we're so grateful to have this opportunity to connect, and we look forward to this, especially some of the ways in which we're innovating and bringing technology into this, as there's many question marks around that. But to just highlight that we have such a robust team, so many different specialties that it really marries all of our experience to better serve our students. So I'll hand it back to you, Jake.
Jessica, thank you. And thanks to all of our panelists on our panel for sharing the innovations taking place at your institutions, the opportunities for all of us to work together. We really appreciate you being with us today. So we have a little bit of time until 1. If we finish early, that's fine. We hopefully will not go over. But I want to just make a couple of announcements as we start to think about a larger conversation, and that is questions for any of our panelists, and then what more could we be doing? What might you be doing at your institution if you'd like to share that we could look at on a statewide scope? And with all of that, I want to share that as Bob mentioned earlier, we are excited to partner with the Mental Health Association in New Jersey. And we've been actively working with the leadership of our council's Economic Mobility Committee. We're pleased that President Stout and President Ciozzi of that committee are with us today. We've been actively working to strengthen how we can support students in the area of mental health. And so we have a couple ideas in play here. One, of course, is today, the convening to kick us all off. Two is working with the Mental Health Association to determine how and in what capacity and scope we will be able to deliver evidence-based training and professional development to all the frontliners, as we've talked about, student leaders, faculty, counselors, support staff, and others. And we're having ongoing conversations about that and more to come on that in the coming weeks. But next, many of you have probably been invited by me or one of the student services affinity group representatives. We're formally launching an affiliate group with the student services affinity group. The community college counselors will be convening monthly, we hope starting in September. Starting in September, we'll be convening monthly to help shape and guide a lot of this work and help provide an avenue for all of you for peer-to-peer support amongst yourselves so that we can continue to share campus-based best practices and find those nuggets of wisdom that we may be able to implement at each of our campuses. So that is up and running. If you're a counselor and you're not sure if you're on the listserv or in the group, it's open to as many counselors at each institution that would want to participate. Just put your name and contact information in the chat. We'll make sure that you're included on the listserv. The listserv is up. It's counselors@njccc.atlantic.edu, counselors@njccc.atlantic.edu. And we will also be hoping to have a similar convening in the fall. Again, this is going to be shaped part of the work ahead for all of us in this counseling affiliate group. We're going to have a similar convening in the fall focused on students to bring our student leaders and students together virtually to have these very important conversations and talk about what we will be able to do to help students help other students. And finally, I'm very pleased to announce, I think it's nice to kind of save this to the ending of the event. Very pleased to announce that a few weeks ago, I got word from the New Jersey Department of Health, and thanks to the Department of Health and the Office of the Secretary of Higher Education, the Department of Health has received a federal Garrett Lee Smith grant. And I am actively in conversations with the Department of Health to talk about how can we partner over the next 5 years to bring critical services and professional development to all of the community colleges. So I'll certainly need our counselors' input on all of that and their advice, but I'm very excited that I'm able to share that news with you. And we're delighted, I hope she's still here, Jenny Blakely from the Department of Health. Jenny, are you on? Is there anything I missed or anything you'd like to add?
Hi, Jake. I don't think you missed anything. I think we are very excited for this partnership and for the next 5 years. And we were excited to hear about the work that you have already started to do. And so I think partnering makes sense as you go on this journey with the community colleges and to have some additional funds and resources to back you all up in the work that you're doing. I think that, you and I still have some conversations. And I think then, at a little bit later point, we can talk to the colleges about what specifically will be available to them, because I think so much information was presented today, and it certainly gave me a better perspective of what the needs are for our county colleges. So I'm excited to move forward, and so far you've been a great partner, and we're just looking forward to it.
Jenny, thank you. Thank you so much for being with us. Thank you for this opportunity with us and this partnership. We look forward to working with you going forward and very much appreciate you working with us. So with all of that said, folks, any questions for our panelists, for any of our presenters earlier today, or any comments about the day that any of you would like to share?
Jake, could you please put in that listserv address in the chat, please?
Sure, absolutely. And just to be,
Sorry, Jake, go ahead.
go ahead. No, I was going to say, just to be clear, the listserv, of course, is going to be open to all the counselors at the community colleges. So we'll be able to post on that back and forth to share information on that listserv closed group for the counselors. But I'll put the address on in the chat as suggested.
So I know at Hudson, we've been working really hard to have culturally responsive, I want to say, programming directed towards race and equal treatment and feeling heard. Are there any specific trainings or out there that is around being culturally responsive to the communities we serve? Does anybody have any, I guess, golden nuggets they want to share with Hudson that they've used a service or a training? We've done a lot of different things. We have a lot of active staff that really support and want the students to have a voice. I wanted to know if anyone knew of any programs out there that they could share.
From the mental health side, the New Jersey Division of Mental Health and Addiction Services works with an organization, a New Jersey Cultural Competency. And I'll get the information to Jake so they can be sent out. They're based in Essex County. They do a lot of really good training. They do it in the mental health world, human service world, but they're an excellent staff and they're really terrific. So I can share that. That's an issue that our association has really been focusing in on over the last year, which we should have been focusing on 20, 30, 40 years ago, but life is what it is. And we're really focusing on that because that's where we see a major effort, to reaching out to the community college level population, but also so many other underserved populations. So we'll share that with you. And I think that would be always something we want to do as a very top priority, is taking training that's effective with all the populations we serve.
So one of the things that we are doing at Hudson is we're being mindful of the language we're using and the tones we're using. We're not saying therapy because sometimes the word therapy does scare people. And we're talking about, our wording, support, healing, with especially people who have faced racial trauma and injustice. They don't need a therapist to tell them what's going on. They need a therapist to help them heal. And we're mindful of our wording and, just being proactive in our presentation, our communication with our students. We want to really best support them, which is give them a voice. And I think training and, teaming up, partnering with other providers that could help train and educate our staff, that would be really great. So thank you for that share, Robert. Appreciate it.
Thank you, Dory. Do.
Other questions or ideas? What more we might be able to do working together collectively going forward?
Is anyone doing anything specific for September suicide prevention? I know with going back on campus, it looks a little different. How are we, I guess, handling programming initiatives and talking about suicide prevention for September?
We have been successful with like social media campaigns, kind of like picking several days out of the month to do Instagram messaging and all like blast email distributions and things. We're also doing like small sort of tailored workshops for student leadership, clubs and organizations, initiatives, so meeting the students in smaller groups sort of that are, like, for example, I'm going to be going to all the clubs and organizations' first meetings or their second meetings, and distributing information, giving some just information and resources. And a few have asked me to do something a little bit more specific.
Thank you. I'm just wondering, because I know it's funny, when I first started at Hudson, my first event I went to was a suicide prevention event. And I've wanted to do something like that. And of course, you know, COVID hit and now we're kind of in limbo of, do we do big presentations? Do, you know, what does that look like? And, you know, just trying to figure it out.
I would recommend Fresh Check Day, and they do have a virtual version of their program, and it is free, funded through a foundation. And if you go, and I put in the chat Fresh Day, freshcheckday.org, I believe is the website. But they will give you all the materials that you need to put on the program, and they will walk you through it. And they are actually scheduling now for the fall. So they're a great organization, and they modified it once COVID hit so that people can offer it virtually.
Thank you. I appreciate that.
Thank you. Other questions or thoughts, folks, for the good of the order? I want to thank everybody for being with us today. This was an important day, an important event, and a very successful event. Thank you to all the partners involved, everyone who was able to join us to share their best practices, their knowledge, their expertise. We look forward to working with all of you going forward on all of this. And should you have any questions, comments, or concerns in the meantime, please just reach out to me at the council office. I'll put my email in the chat before you sign off. And we appreciate you being with us today, and we'll see you again real soon. And thank you especially to our friends at the Mental Health Association for helping us get all of this together. So be well, everybody, and we'll see you soon.
Thank you.
Bye all.
Bye, everybody.
Thank you.